Hello, everyone. It's March 24th on Wednesday, and when we were here on Monday, over the weekend, I think we had I can't recall what it was, but maybe 12 deaths, and we were at the time surely mourning the 12 deaths, and if it was 12, I'm not sure exactly the number, but it surely wasn't a number like 80 or whatever, that was, jump out right at us and everything. But we're always cautious because over the weekend, sometimes we don't get stuff reported and everything, and then it carries on into Wednesday. And so on Wednesdays, we have that uptick. But today, I'm very pleased that we have 7 deaths to report, and so it's just another indication that things are moving the right way, and we just have to keep it up. We surely mourn the 7 deaths, and as is so true now for 2,619 great West Virginians. But we've got to keep moving. We've got to keep going north. We've got to keep trying in every way in the world to get past this, and all the indicators show that we're on our way. So just hang in there, West Virginia. We're not far, but please remember these great people in your prayers and your thoughts, and let them know, please let them know that they're not alone. Our 2,613th death is an 83-year-old male from Wood County. Our 2,614th death, an 89-year-old male from Cabell County. Our 2,615th death, let me step back. I don't know if I said this incorrectly, but our 2,614th death is an 89-year-old male from Cabell County. Our 2,615th death is a 69-year-old male from Barber County. Our 2,616th death is an 80-year-old male from Harrison County. Our 2,617th death is a 56-year-old female from Jefferson County. Our 2,618th death is a 76-year-old male from Kanawha County. Our 2,619th death is a 53-year-old male from Monroe County. Oh, me. Too young, too valuable, too much wisdom. Don't let them become a number, please. We have 389 new positive cases in the last 24 hours with a daily positivity rate of 4.01. Our cumulative percent of positive continues to fall. It's at 5.28. Our active cases are 5,581, and our recovered cases are 130,290. We've upticked as far as the number of people that are in the hospital. We're over 200 again, with 212. Our ICU units, have 73 people in those, and we have 1 red county in Jefferson County. I remind you again and again and again about if you're 65 years of age and older and you would, by chance, have any kind of symptoms whatsoever, please, or you're just anxious about what's going on, please go get a test. If we can catch this early, we can give you these antibodies and we can get rid of this thing and save your life. If we don't catch it early and you truly do have it, you're in for a tough road. That's all there is to it. We've got some announcements today that I want to run through pretty quickly here. That in regard to our summer camps today, I'm signing an executive order that will allow all summer camps to resume on May the 1st. And naturally, we expect these camps to follow all the safety guidelines to protect the people. I am also signing an executive order today that allows live music to resume effective at midnight tonight. And I will expect the same with all these events to follow the safety guidelines. They're all posted on the website. They're all out there. Also today, I am announcing that we are going to stop using our color code system for high schools in West Virginia. This system has been really valuable to us, and it has now gotten to the point in time where we have used this really valuable tool. It's been argumentative at times, but it has served us really well, really, really well. I thank all those that implemented and helped implement this plan. It really protected us in many ways and got us through this, but today, especially with all of our teachers and service personnel that are vaccinated, and all that wanted and accepted the vaccine, and that was a very high percentage. With that, really and truly, this map has outlived its time now, and we need to move forward and everything. So all West Virginia high schools will be open full-time unless there is a significant active outbreak that requires them to close. We'll always monitor. We'll watch as closely as we possibly can. Our health experts and everything, and our team will intervene anywhere and everywhere we have to and everything. But when we originally announced our color-coded map for our school openings, it was the best way that we could make sure that we're keeping our students and teachers safe and everything. It served us really well, and I'm very proud of all those that put it into place. But now it's time for it to go and retire and us move on. So again, I am very happy to be able to say all of our schools are open. They're open full time, and I really think that it's going to only make things better for a void that we had with our students and everything that we had to weather the storm, did we not? And if you just think about it, we've been blessed by not having outbreaks in our schools with our children and everything. But so with how we're moving forward and with the fact that we've got our teachers and our service personnel vaccinated, we're going to move forward with retiring our color-coded map. So if you flash it up there one more time, and I'm going to say bye to a great friend that saved a lot of lives. So dear friend, I'm going to pass you to the side, and we're going to move forward. Okay, from the standpoint of a vaccine strategy, and I'm sure Dr. Marsh and many others will talk to us about this, but we're going to now put up some real effort and focus on the fact that that what we're seeing is that I guess the right word is the transmission rate. We're seeing transmission, not serious illness or death. We've seen that with the over 50, over 65, over 80 group, but we're seeing transmission, significant transmission occurring, with our younger people. And so we're going to make a real effort and everything to get, our younger people vaccinated, and the 16 to 29-year-old group, a lot of college students as well as high school students or whatever. We're going to make a real move on that. Dr. Marsh is going to talk to you about that, and and the value that's going to. That's another West Virginia first move from the standpoint of really trying to cut this thing off at its knees. We've got it moving in the right direction as far as our elderly, and those are the people that get seriously ill and die. But we've absolutely got a transmission issue that we need to really jump back on and cut this thing off at its knees there. So we're moving forward with that. Dr. Marsh will talk more about that in just a few minutes. From the standpoint of our vaccine eligibility and pre-registration and all that kind of stuff, we want you to continue, pre-registering. We want you to know that we're not going to let our foot off the gas and leading the nation and getting our vaccines out there to everybody. We're now available to all West Virginians over the age of 16, and we're still prioritizing those of the elderly, and we're trying to get that number of 65 and plus well over 80%. We're already over 70. We want to just keep moving and get that well over 80, and my goal is 85%. and that would be terrific. As far as the vaccine distribution update, we're at 97.9% of the first and second round doses, and that's all great stuff. To date, we have administered a total doses, get this, in West Virginia arms of 721,869 doses. Hats off to all those from our local health clinics to all those, the first responders, the National Guard, DHHR, great work, great work. As far as a manufacturers partnership, now get this, under my direction, the Joint Interagency Task Force is beginning partnerships with manufacturers and small businesses across West Virginia to facilitate clinics at their facilities and offices. So as of today, we have 10,000 doses that we're going to commit to this, to schedule this week to reach out and get even more people that may be, I don't know, for whatever the reason, they just have not gotten their vaccination and everything. And so we're going to go to the companies and we're going to set up with the companies and vaccinate their employees right there. Some of the companies that we've already partnered with on this first round include Toyota, Procter & Gamble, Pilgrim's Pride, Alliance Coal, and First Energy. And I want to thank these great businesses for stepping up and working with us and everything. And General Hoyer will tell you more about this initiative in just a second, but it's great stuff. Into saving our wisdom so far, the group that we moved so quickly on, and I keep going back because this is the moment right here when we really turned the tide and started saving tons of lives. We have now got in the arms of our elderly, 65 and older, 227,544 individuals have gotten a shot. 154,191 of them have gotten fully vaccinated with the second shot. We have now, this means that when you add up in the doses from our Veterans Administration and from the Federal Pharmacy Partnership with Walgreens, we are above 70% to all our 65 and older population. And like I said, I want to get it to 85. Now we've bumped the goal up to 80, but I want to get it to 85. And I keep encouraging everyone, if you're 65 years of age and older and everything, please try some way to contact us. We're going up every hollow. We're trying every way in the world to get everybody vaccinated. I've got some other things to report here. As far as the new move to have 3 regional clinics, they're going to be in Berkeley Springs, and they're going to be in these counties. They're going to be in Berkeley, Kanawha, and Monongalia counties. And if you're over the age of 65, all you've got to do is contact our hotline, and we will immediately get you in to get your shot. So all this wait list, all this stuff is now we're getting a number of vaccines that we can really move even faster. So if you're over the age of 65, all you've got to do, if you can get to one of these facilities in Berkeley, Kanawha, or Monongalia counties, just call us. Just call us in some way, somehow. Immediately, we will get you in and get your shot. From the standpoint of all West Virginians age 16 and older, pre-register. Go online. If you can't go online, if you'll contact us, we'll walk you through it and everything. Get you pre-registered. All the stuff on the vaccine info hotline is up there and everything. Vaccine reminders, I've said it 1,000,000 times. Literally, come on, West Virginia. Just please, and you've done great. You've done great. Please quit listening to the noise. Please quit listening to people that are in your ear saying, if you take this vaccine, you're going to, in 3 months, who knows what they're saying, grow another arm or something crazy. At the end of the day, absolutely, this vaccine is super safe, and it'll save your life. And if you don't get the vaccine, you're taking a heck of a risk. That's all there is to it. As far as taking advantage of our free testing, please do so. Again, thanks to Frith and Walgreens, great work. I really appreciate all you did with our drive-through pharmacies and everything. And in our long-term care facilities and our churches, now these are numbers that are really low, but these are numbers that are starting to turn a little bit. Just like our hospitalizations, they've turned a little bit. Just like what's going on in many places across this nation, they're turning a little bit. We're still really rock solid in charge and everything, but things are turning a little bit to the negative. We have 2 outbreaks in our long-term care facilities. We're down to 1. We have 8 outbreaks in our churches in 6 counties. That's Braxton, Fayette, Webster, Monongahela, Raleigh, and Nicholas counties. And I think we were down to 1 there as well. We got to do better there, especially in our church community. If we don't watch out, this thing's going to jump up and grab us, and we don't want that to happen. From the corrections update, we have 33 inmate cases and 6 staff cases, and 25 of the inmate cases are at North Central, 3 at South Central, and 2 each at Western and Lakin. All the guidelines are up there as far as wearing your face covering and everything. You got to continue to do that for a little bit longer. Nobody likes it, I get that, but it doesn't matter, whether we like it or don't like it. I mean, really and truly, at the end of the day, this is your first line defense, and it'll save your life. And I urge everyone, if you have had the incredible blessing of getting COVID and making it through it, it seems to me like you at least owe consideration to go give blood. So please consider that. And that's all I've got right now. But the only last thing I'd end with is just imagine this. Imagine through time here, we've gotten vaccinated well over 700,000 people. Do you know how many tests we've done in West Virginia? We have a total population of 1,700,000 and a few. We have tested people in the state of West Virginia of 2,382,655 tests that we've done in West Virginia. We have done in the state of West Virginia the number of total tests. Now, many people have got many different tests, but we have done in the state of West Virginia approaching, now we're not quite there, but we're getting close. We're getting close to have done in the state of West Virginia 1.5 times the total number of people that are out there. We've done a test. It's amazing. It's amazing. You got a lot of people that have really worked and done great work, and I pray to God above, as you see them, you'll absolutely pass on all the appreciation in the world, because what jobs they've done, and I could never, ever thank them enough. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good morning. I am really very enthusiastic that the governor has moved in the direction for the state that he has, and we will. Let me just start off by saying that with our school personnel immunized, both at the teacher level and the service personnel, then I think it is absolutely the right move to retire the MAP and let our children go to school. With that said, we know that we are very much, as the governor has instructed us to, focused on saving lives and improving well-being and maintaining the capacity in our hospitals. And the way that we did that, as we've talked about many times during these briefs, is we've really focused on the people most likely to die and most likely to be hospitalized, which turns out to be residents of extended long-term care facilities, nursing homes, and our West Virginians who are older. Certainly, the majority of people that have died in West Virginia have been over 70 years old. But if we look at 97% of people that have died, they've been over the age of 50 years old, which is a reason why we've really targeted and focused on this group of people, as well as people with pre-existing medical conditions, to be able to prioritize for vaccines. And we still want to maintain our discipline and commitment to do that. But West Virginia, like the rest of the world, is starting to face another great challenge as part of this pandemic. And so there's really two sides to this pandemic. We focused on the save lives and reduce hospitalization side, but there's also the spread of the infection side. And we know that in countries, we have the benefit of kind of getting a bit of a glimpse of the future as we look to Europe. We know that countries like Germany and Italy are really getting overrun with the variants of the virus, the United Kingdom variant particularly. And we're seeing that also happen in the state of Michigan right now. And so West Virginia is blessed to have, great leadership and a wonderful citizenry, but also that we are a bit behind some of the other countries as the United States is, but also some of the other larger states. And so what we are starting to see in West Virginia is the spread of the virus, which is really the key contributor to, to people getting sick in the state, but also the key issue with the variant viruses starting to grab hold and really grow in the state. And we know that our younger people, our 16 to 29-year-olds, are where the spread is taking place in West Virginia and other parts of our country and in the world. And we are starting to see those variant viruses grow in this younger population, particularly the California variants, which are the variants that can infect more easily and tend to be spread from people that are less symptomatic, don't have symptoms. But importantly, we're seeing more now spread of the United Kingdom variant in West Virginia. And that is a particularly concerning issue for us because this variant is not only twice, 50% more transmittable, more infectious, more easy to infect people, but it also is about 50% more lethal. And as we're looking at our hospital numbers, as the governor said, we're seeing a larger increase in our 60 to 69-year-old part of our population, which is really why we want to vaccinate people over 50 with real discipline. But also we're starting to see a little bit of an increase in our 20 to 29-year-old group. And in Europe, we have started to see younger people get sicker with this variant virus. So for the reasons we want to reduce the spread, we're really still going to address the death and the hospitalizations, but now to start to reduce the spread, we really want to focus on this younger part of our population with the same discipline we've done and will do with the older part of our population and people with pre-existing medical conditions. But starting to focus on our high schoolers, 16 to 18-year-old group, with the Pfizer vaccine, and particularly those high schoolers on sports teams, because we're starting to see spread in the schools. That's the most common place for outbreak. And this 2021, we're seeing the spread happen in students. We haven't seen in classroom spread with the safety guards we have there, but we're seeing on sports teams and between children and young adults to age 30, we're seeing more spread. And so therefore, we really want to target the high school population and the college student population. And we want to focus our vaccine strategies on reducing disease there, because these vaccines are really good at reducing spread, but also reducing the variant spread. So we can stop the variants, slow them down, so we can continue to vaccinate more of our citizens. We also want to make sure that when we're seeing these outbreaks, that we're very rapidly doing this genetic sequencing of the virus. And if we do find more variants, we are going to become more aggressive about mandating that those people who are close contacts of folks with the viral variants have a 14-day quarantine or isolation period, and the CDC says you can do a faster one, but we know the variants can stay around longer. So 14 days isolation for people who are primary contacts of folks who have the variant viruses, and we'll do much more aggressive contact tracing in these groups as well, because we really want to isolate those people that can spread the variant viruses, because that's a way that we protect people in West Virginia, protect our younger people up to age 30, but also it buys us more time so that we can continue to vaccinate all of our citizens over 50. And we absolutely ask people to choose to take the vaccine, or people with those pre-existing medical conditions, or people who are in our essential worker category. And the other thing is we really also want to invite families to come together to get vaccinated, because ultimately protecting each person in the family is a real gift to other people that live with each other, but also for extended family members. So thank you very much.
Great, thank you, Dr. Marsh. Now let's go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor and Dr. Marsh pointed out, we're opening up new fronts or parallel paths to get vaccines to the right places. If you look at this from a military construct, when you have the resources available, you open up multiple fronts against the enemy to deplete their capability. In this case, the virus is the enemy, and we're opening up multiple fronts to deplete its capabilities. So you heard the governor talk about our initiatives with businesses ranging from retailers to manufacturers to coal companies to other energy companies. Also opening it up so family members can now be vaccinated with those individuals in these clinics that are set up. Again, we're not taking our eye off of the 65 and above and then the 50 and above population. And actually, as the governor has tasked us to set a new goal now to get to the 85% mark on that 65 and above population. We'll also be working, as we know from a West Virginia standpoint, in responding to emergencies. Churches tend to be our centers of gravity in the state of West Virginia for response. So working with BOAD and our various church denominations to make more available. We'll be also opening up opportunities for various other groups to get family members engaged in this. Next week, we have been given some baseline numbers that will again put us over 70,000 total vaccinations based on all the outlets, to include what we get centrally as well as federal pharmacy and FQHC programs. We are going to see an increase in the number of Pfizer doses available to us next week, which will be particularly important as we get to the younger population, knowing that Pfizer is the one vaccine that allows us to go down to the age of 16. So a lot of efforts going on within the interagency task force with a number of partners. We'll also see a major movement with West Virginia University Medicine next week in 4 areas of the state, and that will be followed by additional hospital clinic support going forward to get to populations. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Hi, good afternoon. Just want to comment on a few things. I am sitting at the JIADA this afternoon, and I do want to thank everyone for all their hard work that they're doing here. We have a lot of people who work here on a daily basis, a lot of community health centers, but a lot of people who are stationed here daily. In follow-up to Paul Mullen's question, he did ask about our flu cases. We are seeing the lowest number of flu cases since 2005, actually, in the state of West Virginia. Normally in February and March, we see a heightened number of flu cases here in the state, but I think with all the mitigation efforts that we've been seeing with hand washing, social distancing, and of course mask wearing, that is why we are not seeing a lot of flu cases. So that's just in follow-up to the question that Paul posed the other day. In addition, Clay did mention the UK variant. We are seeing some cases in West Virginia. To date, we have approximately 24 cases that are spread throughout the state. We have seen that in approximately 9 counties as well. Those are in some of our bordering counties. Of course, West Virginia does have a lot of bordering counties, but that's also to remind people that when it's your time, the vaccine is available. Of course, the governor did, make it available to everyone in the state right now. So anyone 16 and older, Pfizer is available. So we encourage everyone to get vaccinated. It is very important, and also to wear your mask when you're out and about in crowded spaces. But that's all I have for today. Thanks, Jordan.
Thank you, Doctor. And finally to Secretary Bill Crouch with the DHHR.
Morning, everyone. The governor mentioned long-term care outbreaks and where we are. We only have 2 outbreaks in nursing homes and assisted living right now, which is just phenomenal. I want to thank our partners throughout the state of West Virginia. We had a call with them early this morning. They are really tremendous leaders, and with the governor's leadership, which has just been focused on this population from day one, we have reached some great milestones in West Virginia. We were the first to test every nursing home resident in the state of West Virginia, the first state to do that. We're the first to vaccinate all individuals in long-term care and staff in long-term care, the first state to complete that process. We're the first to implement a vaccination maintenance program to make sure that new staff and new patients in nursing homes are vaccinated, and that we maintain those low rates out there. So I tell everyone it's the leadership in West Virginia and those partnerships that we have throughout the state that have really kept us on the forefront of this disease and allowed us to make decisions proactive rather than react to what's happening. With that, I want to remind folks that patients and residents in long-term care have gone many, many months without visitors and have many times been isolated for periods of time. The good news is on March 10th that the Center for Medicare and Medicaid, CMS, issued revised visitation guidance. Both nursing homes and assisted living residences are required to follow those guidelines. There are 9 core principles of infection control and safe visitation. Those include screening, hand hygiene, use of face covering or mask for visitors and residents, social distancing of at least 6 feet apart between persons, instructional signage, infection control precautions, cleaning and disinfecting of high-frequency touch surfaces and designated visitation areas after each visit. This guidance is posted on the COVID-19 website. We're so glad that this population, who has been at highest risk for this, for COVID, for this disease, can now enjoy visiting with their families. So thank you very much.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
Well, good morning to everyone, and it is indeed good to hear Secretary Crouch mention that we've reached milestones. I think that's very evident. We're hearing, as far as members of the media here, fewer complaints about frustrations with vaccine distribution, which I think is also a notable, although there are still some individuals who are concerned about this. What I'm hearing more often now are individuals who are saying, I'm going to wait 6 months or a year or so just to kind of see what the possible long-term effects of this vaccine might be, any side effects and so forth. What's the possible impact of being able to overcome this? Does this prolong the efficiency as far as ending the pandemic with individuals who simply say, well, I think I'm going to wait 6 months or a year? Thank you so much.
Mark, let me answer it. Here's the straight answer. You know me, I don't blow smoke at anybody. I just tell it like it is and everything. What I would say to those people when they said that, I'd look right back at them and say, well, I hope you make it. I really hope you make it for 6 months or a year, because some of you won't. That's all there is to it. Some of you will end up, if there's a group of you and all of you are saying, well, we're going to wait 6 months to a year to just see how things go and what our long-term effects are, some of you are going to die. That's all there is to it. Some of you are not going to make it, and I think that's very foolish. And I think it's, I understand, I get it, and I understand people's maybe hesitation and everything, but in this world, we've got to go with what our medical experts and science and everything is telling us all the time, and they're telling us, that there are some people that have had some adverse reactions to this, and they get a little bit feeling bad, and they get sick maybe for a little while and everything. But we don't hear that people that are taking this vaccine, are growing antlers or dropping over dead or whatever like that. What we hear all the time is just this, Moderna or Pfizer or whomever it may be, Johnson & Johnson comes out and it says, this vaccine is 79% protective, but 100% protective against death and greatly protective against hospitalization. To those people that are saying that stuff, I pray that they'll make it. I just pray that they'll make it. Some won't.
All right, thank you, Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, I had a question directed to me that I couldn't answer, and perhaps it's been talked about on the briefing and I've just missed it, but it goes along the lines of that reports are that the state has received about 200,000 fewer vaccines than national data shows. The state has 200,000 less vaccine doses than national data shows we have. Plus, the state is saying that we've got a 97% administrative rate right now, but a couple of sources, Becker's Hospital Review, the New York Times, they moved that down to 77 to 82%, more of a middle of the pack number. Can General Hoyer or Secretary Crouch, I'm sure there's an explanation in there somewhere, probably about delay in reporting. Could you guys just address the differences in those numbers and when they do eventually sync up? Thank you.
General, I think you've got to go more than anybody here.
Yes, sir, Governor. So, Kenny, we track the execution rate of the doses that we, the state of West Virginia, control centrally and have the ability to administer and have direct administration oversight of. There are the additional doses that go to entities under the federal pharmacy program. There are doses that go to the Veterans Administration, doses that go to the Federal Bureau of Prisons, doses that go to federally qualified health clinics that we don't have the ability to manage the execution of administration. So that's where you see both the difference in the total numbers as well as the difference in the execution rates. So those national entities are probably taking data from CDC, but again, we only have control over a central amount of doses, and that's what we manage our metric off of. And then, as the governor pointed out earlier, in order to get the total percentages over age 65, the actual percentages, we had to go out and query information from the Veterans Administration, from federal pharmacy programs. I want to thank Walgreens and Fruth and those partners that are participating in those programs, making data available to us that we were still attempting to get from the CDC. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you clarify what you said about high schools? I understand we're retiring the MAP, but you said schools would now operate full-time unless there's a significant outbreak. What exactly is defined as a significant outbreak, and who will get to make that call? Is it the individual school administrators? Is it on a county level? Thank you.
Charles, I guess who's going to make that call is the local health departments, but Dr. Marsh, you can answer this a lot better than I can.
Well, thank you, Charles. So we do have guidance that is directed from DHHR and our epidemiologists working in concert with local health departments, county health boards, and the Department of Education that identifies substantial outbreaks, which mean that we have documented COVID in a particular area of that school, and we then determine whether or not the exposure to others from that case, that person, is substantial enough that we need to either have a classroom be dismissed and isolated or quarantined, or more than a classroom. And as I said, because we're seeing more cases happening in schools, and those being congregate settings, that we are particularly focused at doing genetic sequencing of those samples so that we can define whether or not these are variant viruses, of which there's 5 types that the CDC recommends that we report today, which is the United Kingdom variant, the South African variant, the Brazilian variant, and 2 California variants. And so we will do that. And as we mentioned earlier, that if we do identify an outbreak that's caused by a variant virus, then we would require that all people that have meaningful contact, which is still right now from CDC 6 feet in a cumulative 24-hour period of 15 minutes or more, and that's with or without masks. Eventually the CDC hopefully will get to 3 feet versus 6 feet, but that's currently the guidance. Then we would have them be mandatorily quarantined for 14 days, because these variants can hang around longer. And the whole goal here is to protect the people who are involved with this and who may be exposed, but also to reduce the spread. And so we'll be very aggressive about contact tracing in these areas too. I don't know if you have any other comments you'd like to make.
Just additionally that it is, but the health departments with outbreaks, and then the schools nowadays are not being closed entirely. They are by classroom. If there's a outbreak in a classroom, they are just closing those classrooms. We don't see schools closing entirely as well. But to answer you to that, the health departments, the schools, the school boards themselves are, deciding that. But we don't see entire schools having to shut down either. They're just isolating the classrooms and investigating them aggressively with contact tracing. So that's why we're trying to move forward along with the virus, because we want kids to be in school as much as possible. Thanks.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. As we have more people getting vaccinated, we're going to have more people that have those side effects for a day or so after the vaccine. Is there anything you can do to treat those side effects, like acetaminophen or ibuprofen? And about how many people on a percentage basis do have some sort of reaction to getting the vaccine? Thank you.
Dr. Amjad, go, please.
You're on mute,
Thanks, Clay. Paul, we prefer people to use Tylenol. If you do need to use something for pain, we try to avoid ibuprofen or NSAIDs because that can mute your body's immune response to the vaccine. But if you really need to take something, we prefer Tylenol or something like that for pain. If you don't need to take anything, we'd rather you not. But as far as side effects go, we do have some people complaining of minor, aches and pains or flu-like symptoms. But Tylenol would be the recommended thing to take. But you definitely want to speak with your doctor first to make sure you're not having any other medications that might interact with that. But if something minor, I would recommend, a Tylenol if that's the case. But thanks.
Come back to me, Jordan. And I have a recommendation. If you have any level of side effects and everything, small portions of hot fudge cake will make you feel better, and it'll get you through this.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Hi, everyone. Happy Wednesday. I've had a few healthcare workers reach out to me. They received their first dose of their vaccine. They got Pfizer in February with Walgreens, but due to some scheduling conflicts, they haven't been able to get their second dose. So now they're several days past, 5 to 10 days, ranging past that second target date. So, Dr. Clay Marsh, I'd like to ask you, how long can people go without getting their vaccine on their target date, and how long is it safe for? Do they need to double vaccinate? And then Secretary Crouch mentioned last week there were still thousands on priority list that were in the registration system that hadn't received a first dose. Where are we at? And did the DHHR give county health departments those priority lists to help fast track that process? Thank you.
General, please, can you help us here, sir, or should I go to Secretary Crouch and Clay?
Secretary Crouch and Clay, Governor.
Okay. All right. If you guys will take it.
Yeah, thank you, Governor. Yes, those lists are all pushed out to local health departments. We had folks contact, I think I mentioned, all of the individuals, the African-American population age 65 over on the list. We had 1,400 and some individuals. We got through that list in a couple of days. A lot of folks are out and about, so it's difficult to contact everybody and get an answer in terms of whether they still want the vaccine or not. Most of those individuals on the list we're finding have already received the vaccine through Walgreens or their clinic, their FQHC, and other sources. We are happy with that. Again, the list was to try to make sure we get people on that list vaccinated as quickly as possible. We are now pushing out 70 and over and calling those individuals. My understanding is the local health departments have already contacted the individuals that are 80 over on that list, so we're reducing that list quickly now. There is a way to now get an appointment for vaccination through vaccinatefinder.gov, a way to get a link to a pharmacy and have their own and utilize their online system to schedule an appointment. So we want people to do that. But we are reducing the list. We're calling people directly. We're looking at ways to do this faster. The governor directed us to not place people on lists any further. We're trying to get appointments for people when they call. So thank you for the question. We are moving those folks out and getting them off the list.
All right, thanks, Kimberly. Governor, I'll turn it back to you.
Well, I would just end up by just saying this. Through all this, no matter how good the medical experts have been, no matter how many good decisions that I've made or all the people around me have helped me make, you, West Virginia, have done it. You've done something that is absolutely the envy of the nation. Just to tell it like it is, network after network calls constantly wanting to know about West Virginia. All across the nation, if not all across the globe. I mean, it is totally unbelievable what you have done. I mean, if you just step back from it and think just for a second, this thing was coming to our shores, and it was coming in a wave like none of us could have ever imagined. You were the third oldest state and the most chronically ill state, and rated as the most vulnerable of all states, the most exposed. You could have gotten wiped out like nobody's business. And what did you do? You did exactly what West Virginians have done so many times. You stepped up. We stepped up to service all over the lands, all over the world, from the standpoint when we were called upon militarily. But you stepped up and you stayed together and you were smart. Absolutely. Did you not just do exactly that? Now, we can all sit here and be proud of what we've done, the medical teams and everybody else, all across the land. We can all do that. But at the end of the day, West Virginia, hold your head really high and be proud of yourselves. You are the ones that did this. You're the ones that stayed together. You're the ones that looked after one another, your families, your neighbors, all of your communities and everything. And at the end of the day, you have pitched numbers that nobody could have ever imagined how good you have been. By doing so, you made your mark again, as great West Virginians. There's nothing that anybody will ever be able to take that away from you. You know, my dad used to always say this. He'd say, Jimmy, in life, the only thing that nobody can take away from you is your education. And that was his way to keep me as dialed in as I could possibly be in schoolwork and everything. And I was anything except exceptional, But absolutely, in this situation, West Virginia, you have done something and you've put your mark down. Your mark down. Each and every one of you, I love you with all my soul. I thank you for all the goodness that you've done. I thank you for how you've protected one another. I thank you for how you have made the nation awaken again to just how great West Virginia is. God bless each and every one of you. Really proud of you.
The Senate will come to order. All those not having privileges of the floor will please vacate the chamber. Those in the gallery and those on the floor will please rise as we're led in prayer by Jay Eckert, Senate Fiscal Officer. Please remain standing after the prayer as the Senator from Raleigh leads us in the Pledge of Allegiance. Mr. Eckert.
Let's pray together. Almighty God, today we just want to lift up to you each of our men and women who serve our state in leadership roles, and especially their families. Please help to remind our leaders each day why they decided to dedicate their lives to public service and use that commitment to encourage them. Father, please give them strength and wisdom and guide their decisions that they may always put love first. Surround them with people from all walks of life and many backgrounds. Bring to them people of high moral character and spiritual maturity. God, we also ask that you lead our nation in the way that we should go. We are facing immense challenges, a pandemic, financial hardship, economic shutdowns, racial tensions, devastation from violence and riots in the streets, and great political division among many other things. Lord, we know that you are our deliverer, and we pray for our nation and our leaders to turn towards righteousness and away from evil. Lord, help us all to not label what is good as evil or what is evil as good. Please grant all our leaders divine wisdom to navigate our country through the uncertain path that lies ahead. In the name of Jesus Christ, I pray. Amen.
Amen. Senator from Raleigh.
Thank you, Mr. President. With those in the chamber as well as those in the gallery, please join us in reciting the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Reading of the Journal.
West Virginia Legislature, Senate Journal, March 23, 2021. The Senate met at 11:01 a.m. Senator Blair, Mr. President, in the chair.
The senior senator from the 5th requests unanimous consent to further reading of the big journal be dispensed with and the journal be approved. Is there objection? The chair hears none. Further reading of the journal is dispensed with and the journal is approved. Introduction of guests. Senior senator from the 5th.
Thank you, Mr. President. And to the senior senator of the 17th, thank you for giving me this honor. Today, we have as the Doctor of the Day someone that I have grown to greatly appreciate, but my wife and I are very good friends with Dr. Kim Becker. She is from Clendenin, lives in Clendenin, works in Clay County. And when we've had the pandemic, she is one of the people that was on the front lines of trying to help people with COVID, with telemedicine, and she is really here to tell us about, what struggle she had from a broadband perspective in terms of trying to give care in an area that does not have broadband. She has also been on national committees when she was in her residency. She is a Paul Ambrose Fellow, and one of them that I didn't listen to one time in a committee, and she was right. She told me and gave me advice, and I went the other way, and she proved me wrong. I really appreciate what she does, Dr. Kim Becker.
Are there further introductions? Pursuant to the special rule of order adopted on February the 22nd, 2021, the chair announces that the senators from Lewis and Preston have been approved to vote by proxy and have designated the senior senator from the 17th to vote on their behalf. Communications from the House.
The clerk of the House announced that the House amended and passed committee substitute for Senate Bill 9, Continuing Licensed Racetrack Modernization Fund.
The message will be received. Senior Senator from the 17th.
Thank you, Mr. President. I move the Senate concur in the House amendments to Senate Bill 9.
The senior senator from the 17th moves that the Senate concur with the House amendments to Senate Bill 9. Is there discussion? Senior senator from the 17th.
Thank you, Mr. President. The purpose of the bill is to extend the deposit of certain racetrack video lottery proceeds into the accounts of the Licensed Racetrack Modernization Fund. The House amendment would change the $10 million in the language to $9 million to be consistent with current law. The amendment would also ensure that all provisions of current law remain unchanged by adding language to ensure that all the other changes made to the sections remain intact. I urge passage.
Is there further discussion? Senator from Marshall.
Thank you, Mr. President. This is the modernization fund. Is this the fund, actually with a majority leader yield?
Senator yield. Senator yields.
What's this fund do?
So my understanding of the fund, and council's here, so they'll correct me if I'm wrong, but those who want to go to the tracks and they gamble and they want to spend their money, that extra tax is taken out on that money so that it can then be returned to the tracks for which those people want to participate in and to help keep them up to date and help them compete with other folks. So my understanding of it is a taxpayer who does not go to the tracks, doesn't participate, this doesn't take a penny out of their pocket, and it just simply helps those that like that.
Is there any state money involved here?
My understanding, it all comes out of the monies from those participating and at the tracks. It's only held by the state and then returned back to the tracks. So no state tax dollars.
So but it's coming out of the state's portion of the take from the machines, correct?
Yeah, it comes out of the take. There's actually an extra take, my understanding, that is held by the state that then goes back to the tracks.
Okay. All right. Yeah. I'm not trying to be contentious at all, Majority Leader, but I think it's a number of $100 million is a lot of money, and that could be coming to the state that we're handing out to $5 billion companies. You know, there's 5 companies, they're all billion-dollar companies. 4 of them are out of state. 1 of them's in state. And that's what this does. And we have a lot of small businesses in West Virginia that don't get $100 million or even $1. As a matter of fact, we take more from them. And this bill is going to pass. I know it's going to pass because we gave them $100 million 10 years ago, and we're going to give them $100 million again today. I would like to encourage every person to think about this over the...
Senator, are you asking a question of the... if not, are you speaking to the amendment?
I'll speak to the bill. Thank you. Senator,
proceed.
I think that this is a fund that needs to end, period. I don't think that the state should be subsidizing $100 million over 10 years to these entities that are out-of-state billion-dollar companies. I'd encourage the Finance Committee to study it. I'd encourage the Finance Committee to originate a bill that supersedes this bill, that stops this fund immediately. At $100 million, we could go a long way in our state. We have waiver wait lists. We have senior citizens. We have 3 hospitals have closed in the last few years, okay, because PEIA reimbursements are below Medicaid. So PEIA reimburses below Medicaid, but we have $100 million to hand out to billion-dollar out-of-state companies. Think about what we're doing. Thank you, Mr. President.
Is there further discussion? If not, the question before the Senate is the Senate concur on the House amendments to Senate Bill 9. All those in favor will say aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the motion adopted. The question now is on passage of the bill as amended. All those in favor will vote yea. Those opposed will vote nay. The clerk will prepare the machine. Senior Senator from the 17th. How does the Senator from Lewis vote?
Thank you, Mr. President. The Senator from Lewis votes nay.
How does the Senator from Preston vote?
Thank you, Mr. President. The Senator from Preston votes nay.
Has every member voted? Has every member voted? If so, the clerk will close the machine to ascertain the results. On this question, 21 yeas, 13 nays, 0 absent and not voting. More than a majority of those elected having voted in the affirmative. I declare the bill passed. The clerk will communicate the actions of the Senate to the House.
The clerk of the House announced the passage by that body of committee substitute for House Bill 2195 relating to motor vehicle crash reports.
The message will be received and the bill will be referred to the Committee on the Judiciary.
Committee substitute for House Bill 2368, Melissa Smith's law creating patient visitation privileges.
The message will be received and the bill will be referred to the Committee on Health and Human Resources, then the Committee on Judiciary.
Committee substitute for House Bill 2630 requiring DEP to reimburse fines paid by towns, villages, and communities in certain instances.
The message will be received and the bill will be referred to the Committee on the Judiciary.
Committee substitute for House Bill 2760 relating to economic development incentive tax credits.
The message will be received and referred to the Committee on Finance.
Committee substitute for House Bill 2785 relating to public school enrollment for students from out of state.
The message will be received and referred to the Committee on Education.
House Bill 3010 to extend the special valuation method for cellular towers to towers owned by persons not subject to regulation by the Board of Public Works.
The message will be received and the bill will be referred to the Committee on Finance. Communications from the Executive.
There are none.
Reports from standing committees.
Your Committee on the Judiciary has had under consideration Senate Bill 419, redefining firearm to match federal code, and reports back a committee substitute for same, and Senate Bill 458 relating to possession of firearms by individuals during state of emergency, and reports back a committee substitute for same, with the recommendation that the 2 committee substitutes do pass. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received.
Your Committee on Government Organization has had under consideration Senate Bill 470, limiting release of certain personal information maintained by state agencies, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass, but with the further recommendation that it first be referred to the Committee on the Judiciary. Respectfully submitted, Mark R. Maynard, Chair.
The report will be received. Senior Senator from the 6th.
Mr. President, I move to send the bill to the Committee on the Judiciary.
Senior Senator from the 6th requests unanimous consent the bill be referred to the Committee on Judiciary. Is there objection? Chair hears none. So ordered.
Your Committee on Transportation and Infrastructure has had under consideration Senate Bill 474, exempting DOH from purchasing division procedures, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Charles H. Clements, Chair.
The report will be received. Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that the bill be taken up for immediate consideration and read a first time.
Is there objection? Chair hears none. Clerk will read the bill a first time.
Committee substitute for Senate Bill 474, exempting DOH from purchasing division procedures. First reading of the bill.
The bill will be advanced.
Your Committee on Government Organization has had under consideration Senate Bill 488 relating to distributing hotel occupancy tax to convention and visitors bureaus, and Senate Bill 521 extending licensure renewal term of certain private investigators, security guards, and associated firms, and reports the same back with the recommendation that they each do pass. Respectfully submitted, Mark R. Maynard, Chair.
The report will be received.
Your Committee on Finance has had under consideration Senate Bill 534, permitting Economic Development Authority to make working capital loans and revolving loan fund capitalized with federal grant funds, and reports back a committee substitute for same with the recommendation that the committee substitute do pass. Respectfully submitted, Eric J. Tarr, Chair.
The report will be received.
Your Committee on Government Organization has had under consideration Senate Bill 550, providing counties with authority to impose county sales and use tax of up to 1% under certain circumstances, and reports back a committee substitute for same, and Senate Bill 613, adding classification and base salaries of certain civilian employees of State Police Forensic Laboratory, and reports back a committee substitute for same, with the recommendation that the two committee substitutes do pass, but under the original double committee references, first be referred to the Committee on Finance. Respectfully submitted, Mark R. Maynard, Chair.
The report will be received, and under the original double committee reference, the bill will be referred to the Committee on Finance.
Your Committee on Education has had under consideration Senate Bill 585, requiring Board of Education create and provide course in family and consumer sciences in secondary schools, and reports back a committee substitute for same with the recommendation that the committee substitute do pass. Respectfully submitted, Patricia Puertas Rucker, Chair.
The report will be received.
Your Committee on Education has had under consideration Senate Bill 588, requiring county boards of education and county superintendents to comply with instructions of State Board of Education, and Senate Bill 680, allowing State Superintendent of Schools to find classroom teachers certified in special education, and reports the same back with the recommendation that they each do pass. Respectfully submitted, Patricia Puertas Rucker, Chair.
The report will be received.
Your Committee on Government Organization has had under consideration Senate Bill 604, requiring West Virginia State Police follow towing service policies of county, and reports the same back with the recommendation, and reports back a committee substitute for same with the recommendation that the committee substitute do pass. Respectfully submitted, Mark R. Maynard, Chair.
The report will be received.
Your Committee on Health and Human Resources has had under consideration Senate Bill 640, creating Tobacco Cessation Initiative Program Special Revenue Account within the State Treasury, and reports back a committee substitute for same with the recommendation that the committee substitute do pass, but under the original double committee reference, first be referred to the Committee on Finance. Respectfully submitted, Michael J. Maroney, Chair.
The report will be received, and under the original double committee reference, the bill will be referred to the Committee on Finance.
Your Committee on Energy, Industry, and Mining has had under consideration Senate Bill 677, relating generally to minor safety, health, and training standards, and reports the same back with the recommendation that it do pass, but under the original double committee reference, first be referred to the Committee on the Judiciary. Respectfully submitted, Randy E. Smith, Chair.
The report will be received, and under the original double committee reference, the bill will be referred to the Committee on Judiciary.
Your Committee on Education has had under consideration Senate Bill 710, originating in committee, relating to requiring an impact statement in certain instances, and reports the same back with the recommendation that it do pass. Respectfully submitted, Patricia Puertas Rucker, Chair.
The report will be received.
Your Committee on Education has had under consideration Senate Bill 711 originating in committee relating to the school aid formula and reports the same back with the recommendation that it do pass, but with the further recommendation that it first be referred to the Committee on Finance. Respectfully submitted, Patricia Partis Rucker, Chair.
The report be received. Senator from Jefferson.
Thank you, Mr. President. Committee on Education would like unanimous consent to refer this bill to the Committee on Finance.
Okay. Is there objection? Chair hears none. So ordered.
Your Committee on the Judiciary has had under consideration Senate Joint Resolution 1, Protection of the Right to Bear Arms Amendment, and reports back a committee substitute for same with the recommendation that the committee substitute be adopted, but under the original double committee reference, first be referred to the Committee on Finance. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received, and under the original double committee reference, the resolution will be referred to the Committee on Finance.
Your Committee on Finance has had under consideration committee substitute for Senate Joint Resolution 11, Constitutional Officer Term Limit Amendment, and reports the same back with the recommendation that it be adopted. Respectfully submitted, Eric J. Tarr, Chair.
The report be received.
Your Committee on Government Organization has had under consideration Senate Concurrent Resolution 14, creating West Virginia Women's Suffrage Memorial, and reports back a committee substitute for same with the recommendation that the committee substitute be adopted. Respectfully submitted, Mark R. Maynard, Chair.
The report be received.
Your Committee on Transportation and Infrastructure has had under consideration Senate Concurrent Resolution 23, naming the U.S. Marine Corps Corporal Guy Maywood Edwards Memorial Bridge, and reports the same back with recommendation that it be adopted. Respectfully submitted, Charles H. Clements, Chair.
The report be received.
Your Committee on Health and Human Resources has had under consideration engrossed committee substitute for House Bill 2260 relating to procurement of child placing services, and reports the same back with the recommendation that it do pass. Respectfully submitted, Michael J. Maroney, Chair.
The report be received. Reports from select committees.
There are none.
Introduction of bills.
There are none.
Resolutions.
Senate Concurrent Resolution 52 by Senators Blair, Mr. President, and Baldwin by request of the executive, providing for issuance of refunding bonds not to exceed $22 million.
Under the rules of the Senate, the resolution will lie over 1 day.
Senate Resolution 28 by Senator Phillips, recognizing importance of coal-fired power plants and coal resources to West Virginia's future.
Under the rules of the Senate, the resolution will lie over 1 day.
Senate Resolution 29 by Senator Takubo, recognizing 20th anniversary of West Virginia Rural Health Infrastructure Loan Fund.
Under the rules of the Senate, the resolution will lie over 1 day. Motions. Petitions.
There are none.
Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent to return to the fourth order of business.
Is there objection? Chair hears none. Reports from standing committees.
Your Committee on Health and Human Resources has had under consideration Senate Concurrent Resolution 53, originating in committee, improving access to palliative care, and reports the same back with the recommendation that it be adopted. Respectfully submitted, Michael J. Maroney, Chair.
The report will be received.
Your Committee on the Judiciary has had under consideration Senate Concurrent Resolution 54, originating in committee, urging Congress and the President of the United States to protect the Second Amendment of the United States to the Constitution.
The report will be received. Oops.
And reports the same back with the recommendation that it be adopted. Respectfully submitted, Charles S. Trump IV, Chair.
The report will now be received. Unfinished business.
Senate Concurrent Resolution 5, urging Congress call Article 5 convention to impose fiscal restraints on federal government.
Question is on adoption of the resolution. Is there discussion? If not, the question before the Senate is the adoption of the resolution. All those in favor will say aye. All those opposed, no. The ayes appear to have it. The ayes do have it. I declare the resolution adopted. The clerk will communicate the action of the Senate to the House. Bills on third reading.
Engrossed committee substitute for Senate Bill 436 relating generally to solid waste facilities. Third reading of the bill.
Question is on passage of the bill. Senior Senator from the 6th.
Thank you, Mr. President. The purpose of this bill is to recognize the distinction between a solid waste facility and a mixed waste resource recovery facility. The true distinction lies in the materials processed by the facility and the outcome of those materials. A solid waste facility processes garbage, paper, litter, refuse, cans, bottles, and waste for the express purpose of incineration. A solid waste facility is often commonly referred to as a landfill. A mixed waste resource recovery facility processes solid waste for conversion into alternative or supplemental fuel sources and recycles metal and other inert materials not included in the fuel manufacturing. This bill's purpose is to draw a clear distinction between the two types of facilities for regulatory purposes. The language in the bill separates these types of facilities and clearly indicates that a mixed waste resource recovery facility should not be subject to the identical regulation as a solid waste facility. They currently are, yet they perform different functions. This separation would also include fees. These fees include a recycling assessment fee and a solid waste assessment interim fee. The bill would also exempt a mixed waste resource recovery facility from oversight by the Public Service Commission. They would remain subject to regulation and oversight by the Department of Environmental Protection and Waste Management Division. Other similar facilities are not subject to PSC oversight in West Virginia Code, Chapter 22, Article 2, Section 1N. It is important to note that currently there is only one mixed waste resource recovery facility in West Virginia. I'll take questions, otherwise I urge passage of the bill.
Question is on passage of the bill. Is there discussion? If not, question for the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The Senator from Lewis votes yea.
How does the Senator from Preston vote?
Senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The clerk has a title amendment.
Senator Maynard moved to amend the title of the bill.
The question is on adoption of the title amendment. All those in favor say aye. All those opposed, no. The ayes appear to have it. The ayes do have it. I declare the title amendment adopted. The clerk will communicate the actions of the Senate to the House.
Engrossed Senate Bill 486 relating to powers and duties of Chief Technology Officer.
Senior Senator from the 17th.
Thank you, Mr. President. Our question unanimous consent that Senate Bill 486 be referred to the Committee on Rules.
Is there objection? Chair hears none. So ordered.
Engrossed committee substitute for Senate Bill 509, removing requirement that determination of medical stability be found prior to admission of mental health facility. Amendments were pending when we left off on this bill.
Senior Senator from the 5th.
Request unanimous consent to amend the bill on third reading.
Withdraw.
I request unanimous consent to withdraw my amendment.
Is there objection? The chair hears none. Senior Senator from the 5th.
Unanimous consent to amend the bill on third reading.
Is there objection? Chair hears none. Does the clerk have an amendment?
Yes, sir. Senator Klein will move to amend the bill on page 4, section 3A, after line 5, by adding a new section.
Senior Senator from the 5th.
Request unanimous consent to explain the amendment we'll have had it read.
Is there objection? Chair hears none. Senator from the 5th.
Thank you, Mr. President, and thank the body for indulging yesterday and today that this is important to a lot of the areas, and in particular in the area that Senator from Cabell and I represent. This amendment is, and I have two amendments. I understand that, and I will be very frank with you that there is opposition to this. I do understand that, but I want to raise it as a point that this is something we probably need to look at. This just adds in the transportation side for the mentally ill or persons with substance abuse disorder, that when they do the transportation, I'm adding in the arresting officer or certified municipal law enforcement officer. Right now, the county are the ones that are responsible for this, the sheriff's office, and they have to do all the transportation. However, in Section B, it says, upon written agreement between the County Commission on behalf of the sheriff and the directors of the Community Health and Mental Health Center, and then in C, it says the certified municipal law enforcement officer, it actually says that they should have an agreement or can enter into agreements. This is very similar to what's happening in the jail bills, where the counties have to pick up every bit of the cost of the jail bills. And what I'm trying to do here and attempting to do here is having the municipalities, and I'll take my area as an example, the area that we represent. In Cabell County, roughly, half of the people that are arrested come from Huntington, but the county has to pick up all the costs of transporting and taking care of the jail bill and such as that. So I just urge the adoption of the amendment.
Is there discussion? Senator from Marshall.
Thank you, Mr. President. The Senator from the 5th is correct. This is a big issue, and one of the reasons we've been messing around with this bill over the past few days is because we're trying to get the issue right. I think we had a system that was working better in the past, and we changed it a few years ago. Now, this amendment I think it displaces the problem, okay? So we take the problem that we have with the counties, now we displace it to the municipalities, and that's probably even a bigger problem for the municipalities than it would be for the counties. I agree with the senator that we have to look at this and study this, and a solution needs to be had. I just don't think that placing the burden on the municipalities is the proper solution, so I'd oppose the amendment.
Senator from Brooke.
Thank you, Mr. President. I rise in reluctant opposition to the senior senator from the Fifth Amendment, and I do so. There is an issue, and having the burden placed solely on the sheriffs of the counties is a significant problem, and it's one that needs to be addressed, and we need to find a pathway forward. But I'm concerned at this short time, this late in the game on this bill, if we haven't worked with municipalities to have them partake in the same transportation requirements that the sheriffs have to shoulder, what is going to be the burden to small departments, little towns that may only have 3-4 officers, and having to drive down to the southern part of the state with these individuals. And so I fully agree with the senior senator from the 5th, Mr. President, that we need to come to a solution and work a better fix out for this problem. But I just have concerns that at this late in the game and trying to attempt to do it this way, that we would be putting a burden on smaller municipalities that we haven't been able to work fully through. So for that reason, I would have to reluctantly oppose the gentleman's amendment. Thank you, Mr. President.
Is there further discussion? Senator from Cabell.
Thank you, Mr. President. I stand in support of the senator's amendment. It doesn't sound like we have any opposition that's been voiced yet. Everybody seems to be in agreement that due to the horrible opioid addiction and other drug addictions in our state, that the sheriff's departments have been overwhelmed. They're not trying to shirk their duty. they're overwhelmed with this issue because folks with mental illness frequently have substance use disorder, and people with substance use disorder as their primary diagnosis likely have a mental illness or a mental health issue. So for us to say that it's a good idea to do this, but it's too late in the game, all due respect, we're in the game. This is the game. We're basically saying that if you respond to a call and the person is in your custody, that you will do your job and follow through and see that the person gets the help they need at the appropriate mental health facility. So I would urge passage for those reasons of the Senator's amendment.
Is there further discussion? Senior Senator from the 5th wish to close.
Thank you, Mr. President. In closing, I'll say I understand, I do believe this is an issue that needs to be studied, and I think that this is one possible solution. When we look at this issue, and this wouldn't be before us if we weren't correcting an issue before from last year, when sometimes you get information that's not exactly the way they presented it to you. And the Senator from Morgan very articulately talked about that yesterday. If this does not pass, I do hope that we will come back during this session and actually look at these issues, because this is very important. And this is important not only for the sheriffs, but remember the people that they're transporting is important. Thank you.
Question before the Senate is the adoption of the amendment offered by the senior senator from the 5th. All those in favor say aye. Aye. All those opposed, no. No. The noes appear to have it. The noes do have it. I declare the amendment rejected. Are there further amendments to the bill?
Yes, sir. Senator Klein will move to amend the bill on page 4, section 3A, after line 5, by adding a new section designated section 10.
Senior Senator from the 5th.
Request unanimous consent to explain the amendment in lieu of a head read.
Is there objection? Chair hears none. Senior Senator from the 5th.
Members of the body, excuse me, this is something that I really do believe is something that needs to be fixed now. And what this does, and I know that the Judiciary Committee has been reviewing this and looking at this, but in the event the sheriff or arresting officer or certified municipal law enforcement officer is informed by the state hospital that the state hospital lacks suitable bed capacity to place such an individual, the sheriff, arresting officer, or certified municipal law enforcement officer shall transport such an individual to a diversion facility in the state as designated by the chief medical officer of the state hospital. There have been times when you have been holding patients in a county before they could ever find a place. So this will put a directive that they have to have options in place of where else they can go. And in many cases in the Huntington area, and I know in many of your areas, but in Cabell and Wayne, we will be transporting them to Sharp. And sometimes there's not a bed available, and they will hold them for 6 or 8 hours, sometimes longer, before they can find something. So this is, I think, a good solution to this situation. And I'm not saying that there's not further study that doesn't need to be on this as well, but I think this does give one solution to the, and I urge the adoption of the amendment.
Is there discussion? Senator from Marshall.
Thank you, Mr. President. I agree with the senior senator from the 5th. It's actually, it's a shame that we need such an amendment that would direct the hospital to, have to tell us where the beds are. It should not be on, that burden should not be on the sheriff or the arresting officer as far as placement. So and that's been a problem. And although we didn't pass the First Amendment, which would relieve some of the burden off of these deputy sheriffs or whoever else is taking these patients, this one will help a little bit for sure. If you put the burden, if the hospital is full, then it's our job to tell them where there's a bed and where they can go. And I'd urge adoption of the amendment.
Is there further discussion? Does the senior senator from the 5th wish to close? Question for the Senate is the adoption of the amendment offered by the senior senator from the 5th. All those in favor will say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the amendment adopted. Are there further amendments to the bill?
Yes, sir. Senator Maroney moved to amend the bill.
Senator from Marshall.
Mr. President, I request unanimous consent to amend the bill on third reading.
Is there objection? Chair hears none. So ordered.
Mr. President, I request unanimous consent to explain the amendment in lieu of having it read. This amendment corrects a technical flaw in the bill by removing language that is not contained in the original language of the bill. It requires a magistrate, mental hygiene commissioner, or examiner to have training regarding medical causation. The language is contained on page 2, lines 15 through 17. Similar language is contained later in the bill as well on page 2, lines 27 to 29. Mr. President, I urge adoption of this technical amendment.
Is there discussion? If not, the question for the Senate is the adoption of the amendment offered by the senator from Marshall. All those in favor will say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the amendment adopted. Are there further amendments to the bill?
No, sir.
The bill will be re-engrossed, and the clerk will read the bill a third time.
Engrossed committee substitute for Senate Bill 509, removing requirement that determination of medical stability be found prior to admission to mental health facility. Third reading of the bill.
Question is on passage of the bill. Senator from Marshall.
Thank you, Mr. President. This bill removes the requirement that a licensed physician find that an individual is medically stable prior to that individual being admitted to a mental health facility. The bill states that upon admission, a physical exam may be provided consistent with the standard of care by the mental health facility or by a hospital. The magistrate or mental hygiene commissioner may, on his or her own, or upon the recommendation of the examiner, order that the individual be evaluated for a medical condition causing or contributing to the psychiatric presentation, or which might significantly impair or preclude psychiatric evaluation or treatment. The Supreme Court of Appeals is requested to provide magistrates, mental hygiene commissioners, and examiners training regarding medical conditions mimicking, causing, or contributing to a psychiatric presentation. The bill provides if a person is involuntarily hospitalized and is determined after the entry of the order, the behavior which led to the entry of the order was caused by a physical condition rather than a mental illness or addiction, that hospitalization shall not serve to make the person banned under federal or state laws relating to firearms. The bill also provides that in the event the sheriff, arresting officer, or certified municipal law enforcement officer is informed by the state hospital that there's lack of beds, shall transport the individual to the diversion facility as informed by the chief medical officer. That was the last amendment we just adopted. Mr. President, I urge passage of the bill.
Question is on passage of the bill. Is there discussion? Senator from Ohio.
Thank you, Mr. President. Will the senator from Marshall yield?
Will the senator yield? The senator yields.
Thank you. Appreciate that. I want to draw your attention to the second to last line of the bill. Specifically, that's the section that addresses the legal effect of a commitment that's later determined not to be based on mental illness or addiction. And in that second to last line, it says that if that were to happen, that the hospitalization would not serve to make the person a prescribed person under federal or state laws relating to firearms possession. Do you see that section?
Yes.
Can you tell me what authority do we have to do that? And I'm specifically referencing the federal law section of the bill.
I'd have to defer to my Judiciary Chair on the legality of that. I understand the concept. I appreciate the question for the federal aspect of that. You're right. That's the whole point of putting this in there is, the right to have a firearm shall not be taken away from somebody if, in fact, they were admitted to the psychiatric hospital for evaluation, and it was later deemed they were one of the small percent that it actually was not a psychiatric condition. It was a medical condition presenting with some sort of psychosis. So therefore, their rights that they had should be retained. But yeah, I appreciate the question. I'd ask for some help on that one from my Judiciary Chair.
Would the senator from Morgan yield?
Will the senator from Morgan yield? The senator yields.
Yes.
So my concern, Senator, is that there is a federal statute, 18 U.S.C. 922.
922G?
G4 specifically, that makes it a crime to possess a firearm if you've been committed to a mental institution. And so my question is, how do we reconcile that federal statute with the language that we have in the bill before us?
Yeah, you know what? The senator from Ohio has a good point. I don't have section 922G in front of me, and if you have the actual text of it and can read it, that might help. I will concede that the way this is worded in this as to the federal law may be overreach on our part. And if it is, we ought to correct it.
Thank you. And Mr. President, if there's an opportunity to make that correction, I would urge that we do that, whether that's today, seeking unanimous consent to amend the bill on third reading, or to lay it over.
Senate will come back to order. I recognize the senator from Ohio for a motion.
Thank you, Mr. President. I would move to lay over Senate Bill 509 to third reading with the right to amend.
Is there objection? Chair hears none. So ordered.
Engrossed committee substitute for Senate Bill 551, revising forms of living will, medical power of attorney, and combined medical power of attorney and living will. Third reading of the bill.
Question is on passage of the bill. Senator from Marshall.
Thank you, Mr. President. Mr. President, this bill came to us after a couple years of hard work from a lot of stakeholders, including the West Virginians for Life and the Hospital Association, and it relates to the Healthcare Decisions Act. It removes the words, quote, persistent vegetative state throughout the bill. The bill adds language to form starting that the person understands that the removal of life-prolonging intervention would also mean the removal of medically administered food and fluids such as might be administered by a feeding tube. Language is added saying that nevertheless, oral food and fluids such as may be provided by spoon and straw shall be offered as desired and can be tolerated. The special directives or limitations has largely been removed from the living will form as they would serve to prolong life, such as tube feedings, breathing machines, CPR, dialysis, funeral arrangements, autopsy, and organ donation have been added. The effective date is January 1st, 2022, at which time providers shall or should update their forms. Forms executed prior to this time remain in full force and effect. Mr. President, I urge passage.
Question is on passage of the bill. Is there discussion? Senator from Boone.
Thank you, Mr. President. I rise in support of this bill. This is the first time in a long time that we've come back and readdress this issue. End-of-life care is extremely important. I have been an internal medicine doctor and a geriatrician. Geriatrics obviously deals with this case, but we have an incredible asset here in West Virginia, the Center for End-of-Life Care. We many times don't follow the wishes of our loved ones at the end of their life. They do not want to be flogged with IVs and CPR and broken ribs and things like that. We have to be more aggressive, if you would, as physicians, to try to find out their advance directives. It's on us as physicians. What do you want to happen should you develop a terminal illness or if you're in a state where you can't make decisions? And so clearly delineating that is very important. This also goes on to even talk about organ donation and things like that. So this is a nice update. It's, as in all cases, not a perfect bill, but it also discusses what a lot of families have real concerns about, and that is if their loved one is thirsty, or are we starving someone, you know, even though they can't swallow, they have an illness that whatever you do, you're not prolonging life, rather you're prolonging death. So this is a nice step in the right direction. The Center for End-of-Life Care now manages all these advanced directives across the state. It's computerized. Again, if you get down in the weeds, if you have an advanced directive and nobody knows about it, or if an ambulance is called and you know, what are we supposed to do with this patient who's actively dying? So we have to have this conversation so that our loved ones can make a graceful exit. The other thing that gets lost in all this is even though a patient might have an advanced directive that says don't put me on a life support, sometimes that happens And I can tell you, folks, we're spending about a third of the Medicare budget in the last month of life. I think this bill helps delineate that, makes it better, but we still need to communicate with our patients and our public so that people will want to have an advance directive and ask their physicians about it. Thank you. I urge passage.
Is there further discussion? Senator from Marshall wish to close. If not, the question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. Senator from Lewis votes yea.
How does the Senator from Preston vote?
Senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk close the machine to ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The clerk will communicate the actions of the Senate to the House.
Engrossed committee substitute for Senate Bill 565 relating generally to elections. Third reading of the bill.
The question is on passage of the bill. Senator from Morgan.
Thank you, Mr. President. The committee substitute for Senate Bill 565 is a fairly comprehensive bill relating to elections law. It amends 14 existing sections of the state code, and it would enact 2 new sections, all in Chapter 3, which is our elections law chapter, and the amended and new sections are in various articles of that chapter. I'm going to go through quickly the highlights of changes in the law that would be made by this bill. First of all, one of the new sections addresses private election funding, and it prohibits any person from providing contributions of money to county clerks for the administration or operation of elections without prior written approval from the State Elections Commission. There are changes in voter registration under this. It clarifies the voter deadline for electronic voter registration is 11:59 for voter registration on the final day, 11:59 p.m. Our current law is silent on that question. It addresses questions, how the questions are to be asked when people register to vote at the DMV, motor voter. That's addressed by the bill. It has provisions in it that relate to the cancellation of voter registration, and these are for if the elections officials or the Secretary of State receives a notice from a court that a person was excused from jury duty because he or she is deceased or had moved from the residence from West Virginia. It reduces the timeline for confirmation notices to idle voters. Idle voters are voters who are registered to vote, but they haven't voted in elections. There's some changes in absentee ballots. So this bill authorizes voting via electronic absentee ballot for voters who become eligible to vote emergency absentee ballot after the deadline for submitting an application for absentee by mail voting, and expands it to first responders who get called away on an emergency and can't vote on election day. The bill shortens the deadline for receipt of a completed application to vote absentee ballot by mail to 11 days before the election. So that's changed from current law. The Secretary of State's office told us, Mr. President, that this is consistent with the advice that they were given by the United States Postal Service on how far in advance of an election they ought to allow for a time in the mail for a voter to make a request for an absentee ballot, the clerk to send it, the voter to vote it, and send it back. There are some changes to early voting in person, and that's moved back in the calendar now under this bill,
Proceed.
Thank you, Mr. President. It goes under this bill, absent early in-person voting. We used to call it early absentee or in-person absentee, but we just call it early in-person voting now. Will run from the 17th day before the election to the 7th day before the election, at which time it will close. Right now, it runs up until the Saturday before the election. There are changes in the law, Mr. President, the bill on election contests. And so while the county commission and the town council will still be the board of canvassers, will still have responsibility for recounts that have to occur, the authority and jurisdiction for election contests is placed with the circuit court. Circuit court for all election contests. County, district, municipal officers from the county commission to the circuit court, for the statewide offices as well. It requires that a recount be conducted before an election contest may be filed for challenges related to the specific votes cast, votes rejected, or voters who participated in the election. And it authorizes the Supreme Court of Appeals to promulgate rules. There are new provisions in the law on pre-recorded telephone calls. And so the bill and the committee worked hard on this, adopted some amendments to these provisions, but there's information that has to be provided. If somebody's going to make, any entity that's going to make robocalls in to the voters has to tell them essentially who they are, on whose behalf they're calling, et cetera, and that it's a political message. There are fines, big civil fines for failing to adhere to that. There are similar set of rules related to polling, push polling, the disclosures of things that have to be told to the person who receives the call. Finally, Mr. President, there's a new section that relates to criminal offenses. Some new criminal offenses are defined in the bill, and those involve actions to obstruct or interfere with people who are traveling to or from the polls on election day to vote. There are criminal offenses now if somebody actually interferes with them in their efforts to go vote. Mr. President, I'd be happy to try to answer questions. Otherwise, I urge passage of the bill.
Question is on passage of the bill. Is there discussion? If not, the question for the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The Senator from Lewis votes yea.
How does the Senator from Preston vote?
Senator from Lewis, or from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk close the machine to ascertain the results. On this question, 29 yeas, 5 nays, 0 absent, not voting. More than a majority of those present and voting having voted in the affirmative, I declare the bill passed. The clerk will communicate the actions of the Senate to the House.
Engrossed Senate Bill 577, exempting certain fire departments from licensure requirements for providing rapid response services. Third reading of the bill.
Question is on passage of the bill. Senior Senator from the 6th.
Thank you, Mr. President. Senate Bill 577 exempt from licensure fire departments that provide rapid response services under an agreement with a licensed emergency medical services agency that addresses medical training, quality assurance, and liability insurance. The bill codifies current practice. I'll entertain questions. Otherwise, I urge passage of the bill.
The question is on passage of the bill. Is there discussion? Senator from Boone.
Thank you, Mr. President. I also rise in support of this bill. Senator from Logan and I, were made aware of some issues that happened fairly recently where what had been happening for upwards of 30 years could no longer happen. And that is local fire departments would have to be fully licensed as a provider. What's been going on, however, in West Virginia, this rural state where there's lots of volunteer fire departments, is that the local fire departments would then work with the local EMS and then be able to, with their training, et cetera, provide these first responder type care. As we know, the fire departments are frequently the backbone of the EMS system. For them to be fully licensed, they would have to have a medical director and have to have a full quality assurance and all those other things that they can get by just a simple affiliation with the local EMS. So this basically does codify just what's been going on for decades, and I urge adoption.
Is there further discussion? If not, the question before the Senate is, shall the bill pass? All those in favor vote yea, those opposed will vote nay. Clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The senator from Lewis votes yea.
How does the Senator from Preston vote?
The senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent and not voting. More than a majority of those present and voting having voted in the affirmative, I declare the bill passed. Senior Senator from the 17th.
Thank you, Mr. President. I move the bill be made effective from passage and request unanimous consent that the roll call used on passage of the bill be used to make it so effective.
The Senior Senator from the 17th moves that the bill be made effective from passage and requests unanimous consent that the roll call used on passage be used to make it so effective. Is there objection? Chair hears none. On this question, 34 yeas, 0 nays, 0 absent, and not voting. More than 2/3 of those elected to the Senate having voted in the affirmative. I declare the bill effective from passage. The clerk will communicate the actions of the Senate to the House.
Engrossed committee substitute for Senate Bill 590, removing restriction preventing medical marijuana from being in edible form. Third reading of the bill.
The question is on passage of the bill. Senior Senator from Marshall.
Thank you, Mr. President. We passed medical marijuana a few years ago. The purpose of this bill before us today is to remove the restrictions that prevent medical marijuana from being prescribed in the edible form. So therefore, the first part of the bill adds edible to a form in which medical cannabis may be dispensed. And the second part of the bill removes the prohibition that made it unlawful to sell medical cannabis in the edible form. There is one provision that was adopted in the committee that is in the bill that prevents the sale of edible marijuana in the distinct shape of a human, animal, fruit, or any other shape that may entice children. That is prohibited. Mr. President, I urge passage.
Question is on passage of the bill. Is there discussion? Senator from Cabell.
Thank you, Mr. President. When I wrote this medical cannabis bill, it seems like about a decade ago, we did in fact include edible form. So let me start by thanking the health chair for moving this bill forward to the floor. Thank the senator from Wood who added an amendment in committee that improved the bill significantly. Two of my friends are Vietnam combat veterans, and by that I mean the real deal combat veterans. And they both came to me separately over the summer and said, due to the medical conditions I have, one had terminal cancer. If I live long enough, this should be available to me as a way in which I can deal with my suppressed appetite. And that's what motivated me to bring this back to the attention of the body. And I appreciate very much the collaboration that's taken effect, and I urge passage.
Is there further discussion? Senator from Randolph.
Thank you, Mr. President. I rise in opposition of this piece of legislation, and I'd like to start off by saying that when we passed medical marijuana a few years ago, that was a pretty tough vote for me. I actually voted against that legislation in committee, and then after hearing more information from the time it went from committee to the floor, I changed my position and I voted for it because I thought, after looking at all of that additional data, that it was going to do more good than harm, and I still think that. My concern with this piece of legislation, though, is actually who is going to be most negatively impacted by it. And I just did a little bit of research on this, and I'd like to just put out some information for the senators to consider related to this. But in Detroit in 2019, 104 kids were hospitalized because of ingesting medical marijuana. The Journal of American Medicine published a study that said that in Colorado, there was a 34% increase in THC poisoning versus 19% in the rest of the nation, which is roughly double the national average then under that circumstance. And again, the median age in Colorado of this poisoning was 2 years old. So we're talking about 2-year-old kids winding up in the hospital eating gummy bears and so on. And I realize there's an amendment, and I'll talk about that here in a second, but there was an amendment in committee. Massachusetts, a 300% increase in kids under 5 eating THC-infused products and winding up in the hospital. Quebec, so it's not just in the U.S. In Quebec, it was a 300% increase in children winding up in the hospital because of these products. We've seen more kids being charged because little kids don't necessarily know. They grab the baggie that's got this stuff in it, and they take it to school, and the next thing you know, they're being charged with a crime because they're handing out gummies to their friends. And, you know, they don't know any better, so we're causing that problem as well. To touch on the amendment that was offered in committee that I'm aware of, that these things are not to be sold in a form that's enticing to children. As a father of 8 kids, I can tell you if it's got sugar in it, or it tastes like it's got sugar in it, it's enticing to children. But some candies that are out there that are meant to entice children, and again, just a quick look on this, and most of these are in gummy form. We have, by brand name, Gorilla Boogers, Candy Scabs, Earwax, Box of Boogers, Underpants, Camel Balls. Okay. We have jelly beans that taste like barf, moldy cheese, and dog food. We have cat butt gum, and we have zit poppers. I'm not really sure if a kid can be convinced to eat Camel Balls, what form you think you're going to put it into that isn't going to be enticing to children. So I think that while it's well-meaning, I think we should keep in mind that our medical cannabis law has never really got into a full effect. We don't know what it's actually going to look like, and we're already expanding it into an area that states and other countries have seen cause huge increases in children winding up in the hospital ingesting these products. And so, again, respectfully, because I understand the purpose of the senator that sponsored this legislation, I do oppose this legislation.
Is there further discussion? Senator from Cabell, what purpose you seek?
I'm wondering if the senator from Upshur will yield.
Will the senator from Upshur, or
I'm not sure.
Senator from
Where do you live now?
Yield. Senator yields.
Senator from Randolph, excuse me.
Sure, Senator, go ahead.
Senator, I'm glad to see that you're paying attention to public health issues in your comments. Thank you for that. Did you not understand? Are you on health, the health committee?
I'm not on the health committee.
Okay. Did you understand that what the senator from Wood offered in committee that eliminated every item that you talked about? Everything that you mentioned is excluded from the bill by his amendment. Now, I know you're not intentionally misleading this group, are you?
I don't believe that everything that I mentioned is necessarily excluded, but what I would say again is, and my point was, that anything that is in a gummy form or perhaps a chocolate brownie form or anything like that, the idea that you can put it into a form that is not appealing to children, what I was using with that list is simply this. There is no form that is not appealing to children whenever it's chocolate or whenever it's sweet.
What would you say to my friend Tony Humphreys, who flew helicopters over Vietnam? He inhaled all that Agent Orange for those years serving his country as a hero. And he says to me, I've got this cancer and I can't eat. I don't have an appetite. That's reality, Senator. What would you say to him as you oppose this bill that would allow him to have an appetite with his advanced cancer?
In the first place, what I would say again is that part of what we have to do in here is balance these policies. And when we start talking about a 300% increase in the number of children 2 years old winding up in the hospital, and we haven't even given him an opportunity to try the things that are available because we haven't fully implemented the program that we both voted for, I would say that he may have to wait, not because I have an issue with him in particular, but because we can't just throw all this out there and forget about the effect that it's having on our children.
Senator, I'm going to ask you again, have you read the amendment that was passed at the request and on the motion of the senator from Wood? Because you're still talking about things that aren't permitted under the bill.
I don't believe that I am talking about things that aren't related to the bill because I believe, again, that it doesn't, my point in what I listed is if it's got sugar in it, if it's got chocolate in it, it appeals to children. And if you're saying that we're going to require that these gummies taste bad.
They're not gummies. There are no gummies in the bill, sir.
Are there brownies in the bill?
That.
Are there brownies?
You're misleading the body.
Are there brownies in the bill?
So have you read the amendment that was passed?
I did. I didn't see where it said it couldn't be gummies. I saw that it couldn't be in certain shapes.
I'd like to address the bill.
Is there anybody else that wants to be in discussion before I recognize the senator from Cabell a second time? Senator from Harrison.
Thank you, Mr. President. I want to briefly say that fear-mongering is one of the reasons we've not moved forward with the rest of the country on this issue. We passed medical cannabis in 2017. Here we are still trying to get it up and running for the benefit of our veterans, combat veterans, and so many other people that benefit from it. But let me give you just a quick example of what the numbers say. The percentages sound scary. But in reality, and I'm looking at a report from the state of Colorado, from legalization, when marijuana poisonings, prior to legalization, marijuana poisonings were running approximately 10 per year. They went up to 49. Now that's nothing to sneeze about or not take seriously, but there's not some rampant poisoning of juveniles by marijuana, and they have recreational marijuana. But we'll continue to throw out percentages of 150%, 200%, 1,000%, because it sounds great. It sounds devastating. But the numbers are very small. This body needs to take seriously not only medical cannabis, but recreational cannabis. We need to let the voters of West Virginia decide whether or not it should be legal in this state. Alcohol is much more insidious, and I don't see anybody trying to outlaw alcohol, which causes a tremendous number of car crashes, causes spousal abuse, family disruption, and keeps people from working. Now, there's a bill out there right now that permits a county referendum on recreational marijuana. I suggest we quit fear-mongering, look at the facts, and do what's right for this state, Mr. President. I urge passage of SB 590.
Senator from Brooke.
Thank you, Mr. President. I just wanted to, I was at the, I hate to correct my good friend from Cabell, but I was the one that set forth the amendment in healthcare, or Health Committee, not the Senator from Wood. I hadn't thought of at the time, and I apologize if I was not clear enough when I made the amendment. My amendment would allow for gummies to be as part of the edible. Now, it does preclude, if there are going to be gummies, it could be in any form, it does not preclude gummies, but if something is going to be a gummy or any other version of an edible, it would not be permitted to be in the shape of a human or an animal or fruit or any shape that will entice children. And I took that from Colorado law. And so I just wanted to ensure that the body was aware of what my amendment was, and if it was not clear enough, if I didn't make that clear to everybody on the committee, then I apologize. But that still would be permitted. But again, it was my intent to make it so that it was not attractive to children and mirror the Colorado law. Thank you, Mr. President.
Is there further discussion? Senior Senator from the 17th.
Thank you, Mr. President. I did not intend to speak upon this bill, but there is a few points I would like to make, and the senator from Harrison already made one of those for me, and that is a lot of the percentages that you see, you have to understand the difference between absolute and relative. And so if there is one case and all of a sudden it goes to 2 cases, that's a 100% increase. And so when you actually look at the incidence of drunk driving and fatalities and overdoses and hospitalizations, there are significant percentage increases in the relative number, but the absolute number is actually fairly small. Now, for every bad incident, that's still unfortunate. But just to keep that in mind, in terms of other comments I've heard, there's a difference between parenting and a balance between a responsibility of a parent for their child. If a parent goes and obtains this or any other medicine or Tylenol for that matter, it is incumbent upon that parent to safeguard that for their children. And so although I do agree that we should try to mitigate as much of the attraction and allure for a child to go eat these products, at the same time, they're products for adults that I think are coming, regardless of what this body wants to do or not. It'll happen federally if it doesn't happen on the state level sometime soon. I think it is important to maintain a balance. I think that there's no doubts that there are medicinal benefits of marijuana. The concern I have, and the reason I voted against marijuana in the first place, is because you smoke it, and it certainly can cause lung damage, and anything you put into the lungs that's not meant to be there other than air is not going to be helpful. But I do think there's also medicinal benefit. I've testified on or spoken on the floor regarding what my patients have told me. I've had cancer patients that was losing weight, was in bad pain, that I could see that they were gaining weight, they looked better, and I asked, they're not requiring or asking for recurrent prescriptions for narcotic medications, and I ask them, and they'll say, Doc, I started smoking marijuana, and in the past they've been very apologetic, and I said, don't ever apologize for that. Anything that will help you, don't apologize for that. So there are medicinal benefits, and so if you take away the edible faction, the way I balance this in my mind is there are some people that could benefit, perhaps like the gentleman from Cabell. I suspect he probably smoked heavy tobacco because that's what they did back in World War II and Vietnam and still. So he may not have the greatest lung function. And so in order to get those, if we take out edible, I can tell you what they're going to do. They're going to try to make concoctions themselves. They're going to try to make edible forms themselves because if they smoke it, they might not be able to breathe afterwards. They're trying to help an ailment but hurt another one. And so in my mind, if there is a regulated, manufactured way of producing that in an edible form that gives them another entry route that can hopefully alleviate some of their issues, some of their ailments, while at the same time, allowing them to breathe, not damaging their lung function, there is a balance. And so I have the very concerns that our senator talked about, these being inedible and being attractive to kids. I've made the same arguments. I think as a body we need to safeguard against that as much as possible, but at the same time look at the other side of the scale and help those that need this as much as possible. So for those reasons, I'm in favor of the bill. Thank you, Mr. President.
Further discussion, Senator from Wood.
Thank you, Mr. President. I hate to rise against my good friend from Cabell's bill. He is my buddy. I wasn't going to speak on this, so I had a lot of information with me in a committee that I gave in terms of the dangers of these, which were gummy bears or that type of thing, which my friend from Brooke did a great job with an amendment from Colorado taking care of it. I just want to mention a few things that fundamentally these marijuana issues and bills and medicinal and so on, I believe, are clearly and almost transparently about kicking the door down for recreational marijuana. There is not a recreational state in the Union that wasn't initially a medical marijuana state. And this is a little piece of this. And of course, as my friend from Cabell talked about his combat veteran friend that needs these. There's a legitimate process that you can go through with the FDA, get these medicines approved and onto the market that can help folks without grinding down the wall that protects our citizens against recreational marijuana, which is a top-tier drug. I forget the word, but you know what I mean. It's very lethal. So just two more quick points. The THC in marijuana has grown exponentially and is much, much greater than it was years ago. And one of the dangers of these ingestibles is that when you smoke marijuana, you feel the effects almost instantly, but when you consume them and digest them, it takes a while for it to get into your bloodstream and feel the effects. And so you can try to compensate for that by eating more than you should, and it can be a danger to your health. And hospital visits with children and so on have grown many times, and I apologize, I don't have the numbers. I had them in committee and gave a lot of good information, so I apologize for that. But I do recommend a no vote on this bill for those reasons. Thank you, Mr. President.
Is there further discussion? Senator from Cabell for the second time.
Thank you, Mr. President. I appreciate the indulgence, and this has been a very informative debate. For the newer members, I want you to know that when we pass this medical cannabis bill, it is the most conservative in the country, the tightest, the most conservative bill. You can go to Ohio or other states that have medical cannabis, and it's sort of no holds barred. Our legislation, the medical cannabis bill of 2017, is very restrictive. You must go to a physician. You must have one of the, very serious illnesses. You must follow all the rules. I'm not sure I'm even in favor of legalizing recreational marijuana. That's a whole different argument for a different day. And it's a little bit counterproductive to discuss that today when we're talking about trying to help people that have MS, that have a disease which is going to take their life within a year, that have terminal cancer. So these are the people we're trying to help medically. And I would just urge you to leave the debate for recreational marijuana to some other year, to some other group. We're not debating that today. We're not voting on that today. Thank you.
Further discussion. Senator from Marshall wish to close debate. Well, one moment. Senator from Randolph for a second time.
Thank you, Mr. President. I just wanted to clear up a couple of things, and I want to thank the senator from Brooke for doing at least part of that, but with permission, I would like to read what that amendment language actually is so that everyone's clear. It says edible, provided that the sale of edible marijuana products, including but not limited to the distinct shape of a human, animal, or fruit, or any shape that may entice children, shall be prohibited. It says absolutely nothing about whether or not that can be in the form of a gummy or chewing gum or any other particularized product. It's only to do with what the shape of the product is. And so, again, this is something that in other states has had a dramatic effect. Some folks have tried to sort of say, well, yeah, but if you take one and make it two, that's a 100% increase. And that's why one of the first things that I mentioned was Detroit. Because for Detroit, it was 104, not a percentage, it was 104. And 104 out of a population of 650,000. So about a third of the population of the state of West Virginia, which means that in the state of West Virginia, we could expect perhaps as many as 300 kids to overdose on THC eating these products. We're not talking about a percentage of going from 1 to 2 or even 5 to 10. We're talking about potentially hundreds of West Virginia children winding up in the hospital because of these products being out there and ready for them to consume. And yes, we have other things that we use. We use, hydrocodone or Percocet or whatever, but almost all of those products, when you go to the doctor and you get your prescription, they put it in a bottle that by federal law is childproof. This comes in a baggie or something like a baggie that every kid can open. So that's why we see in these other states it's 2-year-olds, because it's not childproof. This isn't something that came across from a pharmacy that was specifically designed to prevent children from being able to get access to it in that way. So again, I would just say, maybe we should let the program fire up a little bit, trial it out a little bit, and something like this can be revisited at that date. Thank you, Mr. President.
Senator from Marshall to close the debate.
Thank you, Mr. President. It's a nice debate on a very controversial subject, obviously, but so I'll add to it just a little bit here. But whether or not you're for medical marijuana or against medical marijuana, that's not really the question here. The state that we represent, the constituents that we represent, overwhelmingly in the mid to high 80% support the use of medical marijuana on every poll that I've ever seen. We're here to represent them. We passed this bill 4 years ago. I think the fact that we don't have the program up and running already is embarrassing for the state. I think we should have had it up and running already. It's 4 years. It helps a lot of people. It could help a lot of people. Some of those people are gone. And the fact that we haven't, implemented this program, I really would encourage a more rapid pace for, the implementation. But the fact is we haven't. And if we pass the bill, it passed overwhelmingly. And with all this does is allow a different route of entry of the same medicine. There's rulemaking provided in the bill. The rulemaking could certainly include childproof containers along those lines. We didn't address that in the bill itself, but that could certainly come forward in rules. The goal of this legislation is to help patients that need the help, and the science is very clear. There's a lot of disease processes where the patients have a significantly better quality of life with medical cannabis. Some of those patients can't wear a patch for different reasons, skin disorders or dizziness or whatever. Some patients can't do the oils. All this does is try to just allow another route that someone else that may not be able to take the same medicine by a different means has access to the same treatment. I'd urge passage of the bill.
Question is on passage of the bill. Question is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The senator from Lewis votes nay.
How does the senator from Preston vote?
The senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk will close the machine to ascertain the results. On this question, 26 yeas, 8 nays, 0 absent and not voting. More than a majority of those present having voted in the affirmative. I declare the bill passed. The clerk will communicate the action of the Senate to the House.
Engrossed committee substitute for House Bill 2621, mandating certification for certain members of fire departments, requires certain types of training, allows specialized personnel who are not firefighters to be members of a department, and require the postings of fire department evaluations. Third reading of the bill.
Question is on passage of the bill. Senior Senator from the 6th.
Thank you, Mr. President. House Bill 2621 amends the content of certain training for firefighters. The bill requires the Fire Commission to certify the chief of every fire department and allows the commission to discipline fire chiefs or acting chiefs who do not operate their fire departments in compliance with applicable laws and rules. House Bill 2621 also requires the Fire Commission to develop procedures to authorize individuals who are not certified to fight fires but who are trained to perform specialized functions such as swiftwater rescue and confined space rescue to be members of a volunteer fire department. Finally, the bill requires the state fire marshal to issue a certificate following the evaluation of a fire department and requires the fire chief to post the evaluation so that it is visible to the public and members of the department. House Bill 2621 is supported by the West Virginia Fire Chiefs Association. I'll take questions, otherwise I urge passage of the bill.
Question is on passage of the bill. Is there discussion? If not, the question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th. How does the Senator from Lewis vote?
Thank you, Mr. President. The senator from Lewis votes yea.
And the Senator from Preston, how does he vote?
The senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the result. On this question, 34 yeas, 0 nays, 0 absent and not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The clerk will communicate the actions of the Senate to the House.
Engrossed committee substitute for House Bill 2797, declaring certain claims to be moral obligations of the state. Third reading of the bill.
Question is on passage of the bill. Senior Senator from the 4th.
Thank you, Mr. President. This is the annual claims bill. These are claims that have been found to be moral obligations of the state of West Virginia by the Claims Commission. These claims would traditionally have been brought in a regular court, but for the constitutional immunity granted to the state. Mr. President, I urge passage of the bill.
Question is on passage of the bill. Is there discussion? If not, the question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th. How does the Senator from Lewis vote?
Thank you, Mr. President. The senator from Lewis votes yea.
How does the Senator from Preston vote?
The senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, and not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The Senior Senator from the 17th.
Thank you, Mr. President. I move the bill be made effective from passage and request unanimous consent that the roll call used on passage of the bill be used to make it so effective.
The Senior Senator from the 17th moves that the bill be made effective from passage and request unanimous consent that the roll call used on the passage of the bill be used to make it so effective. Is there objection? The chair hears none. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than 2/3 of those elected to the Senate having voted in the affirmative. I declare the bill effective from passage. The clerk will communicate the actions of the Senate to the House.
Engrossed House Bill 2854, relating to the West Virginia Municipal Police Officers and Firefighters Retirement System. Third reading of the bill.
Question is on passage of the bill. Junior Senator from the 17th.
Yes, thank you, Mr. President. House Bill 2854 is very similar to Senate Bill 467 that this body passed on the 9th. What this does is it affects the municipal police officers and firefighters retirement system. There are 4 clarifications within this bill. It provides a definition of the term of beneficiary. It provides for a member's contributions to be returned to a member's beneficiary or estate if the member dies outside the line of duty or with fewer than 10 years of credited service. Third, it specifies that any disability benefit payment to an eligible member will begin the first day of the month following termination of employment and receipt of the disability retirement application by the Consolidated Public Retirement Board. And lastly, it provides for a recalculation of benefits for any member who retires and later resumes employment. Mr. President, happy to answer questions, and I urge passage.
Question is on passage of the bill. Is there discussion? If not, the question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The Senator from Lewis votes yea.
How does the Senator from Preston vote?
The Senator from Preston votes yea.
Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The clerk will communicate the actions of the Senate to the House.
Engrossed committee substitute for House Bill 2855 relating to the Natural Resources Police Officers Retirement System. Third reading of the bill.
Question is on passage of the bill. Junior Senator from the 17th.
Yes, thank you, Mr. President. House Bill 2855 is similar to Senate Bill 456 that this body passed on the 9th of this month. This affects the DNR police retirement system. 3 areas of cleanup language include the definition of the term beneficiary. It clarifies that employee contributions under the plan shall be at 9.5%. And lastly, it provides for a member's contribution to be returned to a member's beneficiary or estate if the member dies outside the line of duty with fewer than 10 years of credited service. Happy to answer questions and urge passage, Mr. President.
Question is on passage of the bill. Is there discussion? If not, the question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Senior Senator from the 17th, how does the Senator from Lewis vote?
Thank you, Mr. President. The Senator from Lewis votes yea.
How does the Senator from Preston vote?
Senator from Preston votes okay. Yes.
Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than a majority of those present and voting having voted in the affirmative. I declare the bill passed. The clerk will communicate the actions of the Senate to the House. Bills on second reading.
Committee substitute for Senate Bill 361, extending supervision for conviction of soliciting minor or using obscene matter with intent to seduce minor. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 483, allowing oaths be taken before any person authorized to administer oaths. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 487, updating Division of Purchasing Procurement and spending thresholds. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 610, providing tuition and fee waivers at state higher education institutions for volunteers who have completed service in AmeriCorps programs in West Virginia. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Senate Bill 644, exempting certain persons pursuing degree in speech pathology and audiology from license requirements. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Senate Bill 651, allowing county boards of education to publish financial statements on websites. Second reading of the bill.
Are there amendments to the bill?
Yes, sir. Senator Trump moved to amend the bill by striking out everything after the enacting clause.
Senator from Morgan.
Thank you, Mr. President. I request unanimous consent to explain the amendment in lieu of having it read.
Is there objection? Chair hears none. Senator from Morgan.
Thank you, Mr. President. The amendment preserves everything that's in the bill. This is the bill that allows county boards of ed to publish on their website their annual financial statement instead of in the newspaper. Current law requires only the newspaper. The bill says either or. The floor amendment includes all that, but it adds a couple additional provisos. First of all, it puts the start of that change out till July 2023. So that was not a provision that was in the bill as it left the Education Committee. The second thing the floor amendment does that's different from what the Education Committee did is that it requires a public hearing. The County Board of Education has to have a public hearing on that question. Do we have to publish? Do we publish in the newspaper or do we publish on our website before they make the decision the first time? And then the other thing that the amendment does is it says that if the board decides to publish on its website instead of the newspaper, then it goes back to the publication of all the information that used to be required under Chapter 18 before the legislature made its amendments in 1993 or 4 and 2000. It used to be a much more extensive publication, and the legislature changed that, at least I think the first time 25 years ago, and allowed some of the financial data to be published in the newspaper in the aggregate. And as I recall the debate and discussion on that legislation, it was to lower the cost for the county boards of education if they had to publish. This will take it back to the way it was if they're going to put it up on the website, which won't cost them anything to do that, and require them to republish the date and payee and amount of every check they write for $250 or more. And then if they write multiple checks to entities or people, the aggregate number for each entity or person. Be happy to try to answer questions, Mr. President. Otherwise, I urge adoption of the amendment.
Is there discussion? Senator from Jefferson.
Thank you, Mr. President. I do not have any problem with this amendment. I believe that this is a good amendment. It preserves the intent of the bill. It actually increases transparency, and it continues to allow for the counties to have the option. So therefore, I support the amendment.
Is there further discussion? Senator from Harrison.
Thank you, Mr. President. Briefly, I oppose this bill on the grounds that 45% of our state does not have access to high-speed internet. Taking county boards of education's financial statements out of the public purview takes away an important oversight for the financial expenditures of a significant taxing authority in our state. Why would we do that? Certainly allow them to put them on the website might be an addition, but if I understand the bill correctly, they'll no longer be published in our local newspapers. Well, that has an effect on our local newspapers. That's not what we should be concerned about. We should be concerned with allowing people to view how their tax dollars are spent. I would oppose this bill, Mr. President.
Further discussion? If not, question for the Senate is adoption of the amendment from the Senator from Morgan. All those in favor will say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the amendment adopted. Are there further amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 658, requiring sheriff's departments to participate and utilize Handle with Care program for trauma-inflicted children. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Engrossed committee substitute for House Bill 2400, authorizing Department of Transportation to promulgate legislative rules. Second reading of the bill.
Are there amendments to the bill?
Yes, sir. The Committee on the Judiciary moved to amend the bill by striking out everything after the enacting clause.
Senator from Morgan.
Thank you, Mr. President. House Bill 2400 is a rules bundle from the Department of Transportation. The Judiciary Committee amendment is a strike and insert.
Excuse me, Senator, for 1 minute. Senator from Morgan requests unanimous consent to explain the amendment in lieu of having it read. Is there objection? Chair hears none. Senator from Morgan.
Thank you, Mr. President. Sorry about that. Let me find my amendment. The Judiciary Committee amendment is a strike and insert amendment for the rules bundle, and let me double check. This was one where one of the rules promulgated was placed initially in the wrong bundle. Thank you, Mr. President. Sorry about the delay. The amendment adds new language in Division of Motor Vehicles rule, and the new language says, in the commissioner's discretion, the division may accept a Social Security number provided by any applicant for a driver's license or identification card without a document presented as proof of Social Security number when the United States Social Security Administration verifies the Social Security number electronically, except for license types where a Social Security card or document submission is mandated by federal law or regulation. So apparently, I think what we learned when we considered that was that the DMV has the capability in some circumstances of verifying electronically with the Social Security Administration. Urge adoption of the amendment.
Is there discussion? If not, question for the Senate is adoption of the amendment offered by the Committee on the Judiciary. All those in favor will say aye. All those opposed, no. The ayes appear to have it. The ayes do have it. I declare the amendment adopted. Are there further amendments to the bill?
No, sir.
The bill will be advanced to third reading.
Bills on first reading. Senator from 17th.
Thank you, Mr. President. I request unanimous consent that all bills on first reading be considered read a first time and advanced to second read.
Is there objection? Chair hears none, so ordered.
Committee substitute for Senate Joint Resolution 9, Disabled Veterans Exemption from Ad Valorem Property Taxation Amendment.
Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that the resolution be referred to the Committee on Finance.
Is there objection? Chair hears none, so ordered.
Committee substitute for Senate Joint Resolution 10, limiting the terms of members of the House of Delegates and Senate Amendment.
Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that the resolution be referred to the Committee on Finance.
Is there objection? Chair hears none, so ordered. Introduction of guest. Remarks by members. Senator from Marshall.
Thank you, Mr. President. I'm going to expand a little bit on what I was talking about earlier today. We voted today to subsidize these private industry with $100 million. 21 of us voted for it. there's four racinos in this state and one casino, and that's who gets this $100 million. Just with respect to the racinos, the two of them are by the same company. It's a private company. They're worth about $5 billion. They're an out-of-state company. There's another one that's somewhere in the neighborhood of $15 to $20 billion. They're an out-of-state company. There's another one that's in the neighborhood of $15 to $20 billion. They're an out-of-state company. So what did we just do? We gave these billion-dollar companies $100 million. I mean, why? We're in the middle of a pandemic. We have a ton of small businesses in our own state. They're suffering. They've suffered for a year. What do we give them? Nothing. I guess it's the political process. You make a big donation, you get $100 million, then you laugh all the way to the bank. I think it stinks. I think it stinks. I'll tell you, they're treated differently. These small businesses are treated differently than the big businesses. Okay? And gambling, a lot of people are against gambling. I'm not against gambling. I think it's everyone's right to gamble if they want. I gamble. In moderation, it's entertainment. I understand people get addicted to gambling. I understand people get addicted to lots of things. But our state's economy is dependent upon it. Okay? I think we should maximize it. Let's look at the casinos versus these LVLs. That's our two big entities, right? So, on a machine, you got a machine. The LVLs have to rebuy their machines for tens of thousands of dollars every so many years. They have to pay $1,000. These are our small businesses, our restaurants, our taverns, bars, restaurants, whatever. They got to pay $1,000 every year, some sort of, I don't know what we call that tax. And the state takes 52 cents off the dollar. So 52 cents off the dollar, $1,000 every year, and you got to rebuy the machines. $10,000, $15,000 per machine every so often. Let's look at the other side. Let's look at the casinos. 30 cents on a dollar for the machines as opposed to 52 cents. They don't pay this $1,000 tax. They don't have to rebuy machines or buy machines. Oh, and by the way, we'll give you $100 million on top of all that. That's what we do. So they came to us a few years back and wanted to do sports wagering. And so we did it. It could create a ton of jobs, hundreds of jobs. I think it's created about 6, maybe 7. We made $7 million as a state in sports wagering since June of 2018. That's when it started. 7 million, and then another 500,000 on top of that for licensing fees. So 7,500,000, almost $8 million. Pennsylvania started 2 months after we did. They're approaching $1 billion. Ours was 8 million. They're approaching $1 billion. If you correct it per capita, they're about 100 million to our 8 million. We did it wrong. We gave it away. The implementation by these private companies has cost the state millions of dollars. And here we are protecting them further. We're protecting them, we're preventing competition from entering. There's no reason these licenses should be tethered to these casinos. And there's no reason we should be giving these, subsidizing a private industry that's traded on a stock exchange of $100 million. Why are we subsidizing these private companies? I just don't get it. And we're at the expense of our own state's small businesses. Mr. President, this has been weighing on me this whole session. I was hoping for a solution. It hasn't come, probably won't come. These things always end up in court. But I finally just felt like I had to speak about it a little bit. I'm going to continue to speak about it. I'm going to talk about this a lot over the next couple of years every so often until we find a solution that allows free market competition in this industry and maximizing the dollars for the state. The state could use the money. We have lots of the sexual assault women came to us. They're getting $250,000 a year. PIA, I mean, the waivers. I mean, we go on and on and on with all these parts of our states that need extra funding. And here we're just doling it out. So with that being said, I'd like to revisit all this over the interims in the next year, and hopefully we can come to a better conclusion. Thank you, Mr. President.
Remarks by members. Senior Senator from Greenbrier.
Thank you, Mr. President. It's good to see you representing the 10th District up there in the podium. I respect. Today's Equal Pay Day, which I confess that I did not know hardly anything about until earlier today. Why is it called Equal Pay Day? Well, it's called Equal Pay Day. Well, the thing about Equal Pay Day that I didn't realize is that it changes every year. And it changes every year because it represents the amount of time a woman needs to work into the next year to make as much as a man in the previous year. And so this year, it's March 24th, which is why today's Equal Pay Day. So to translate that, the average woman must work about 15 months to make what a man makes in 12 months. And in West Virginia, it's a little bit worse than the national average. Women make about 74 cents to the dollar. Women of color actually make significantly less. It takes Latino women about 23 months to make what a man makes in 12 months. And so we see the gap in other ways throughout our society. If you're a sports fan like me, you may have seen recently the pictures of the NCAA women's tournament, the difference in their meals and their training facilities as compared to the men. But once there was a little sunlight placed on that issue, it changed. The women's tournament got a nice upgrade, fast. So, Mr. President, I rise today to place some sunlight on the issue of pay equity. There are 13 states across this nation that have passed pay equity and transparency measures in the last couple years, and I hope West Virginia will join that list soon. You know, I mentioned before that I didn't know this was Pay Equity Day, and I didn't know what that meant. I remember one time I was talking to a group of women about this issue, and I was just kind of, I guess, doing what men do. I was trying to fix it. I was trying to fix it and say, well, we just got to change the numbers and we'll fix it. And they said, no. You're not listening. You're not hearing what I'm saying. This is not about money. This is about trust. And this is about transparency. We need to talk about this. So as we work towards policies that can engender better trust and transparency, and our businesses do the same thing. Our businesses are working on this already. Let's take some time today to shine some sunlight on an issue that affects each one of our families here in this chamber. Thank you, Mr. President.
Remarks by members. Miscellaneous business. Senior Senators from 17th.
Thank you, Mr. President. Subject to announcements, I move the Senate stand adjourned until tomorrow at 11 a.m.
Are there announcements? Senator from Morgan.
Thank you, Mr. President. The Committee on Judiciary will meet today at 3 o'clock p.m. in the Judiciary Committee, Room 208 in the West Wing.
Senior Senator from the 4th.
Thank you, Mr. President. Your Committee on Finance will meet today at 3 p.m. in room 451M.
Senator from Brooke.
Thank you, Mr. President. Your members of the Republican caucus will meet in room 330 West, 30 minutes following the floor session. Thank you.
Junior Senator from the 17th.
Thank you, Mr. President. Your Committee on Pensions shall meet today at 2:30 in House Finance 451, Senate Finance 451.
Further announcements? Senior Senator from the 10th.
Thank you, Mr. President. The Democratic members of the Senate will caucus 30 minutes following the conclusion of the floor session here in the chamber. Thank you.
Further announcements? If not, the question before the Senate is the Senate stand adjourned until tomorrow at 11 a.m. All those in favor say aye. Aye. All those opposed, no. The ayes appear to have it. The ayes have it. I declare the Senate adjourned.
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Members and guests may be seated. Reading of the Journal.
Journal of the House of Delegates, Charleston, Tuesday, March 23rd, 2021.
Gentleman from the 51st, Douglas Hanson.
Mr. Speaker, I ask unanimous consent that the further reading of the journal be dispensed with and it be approved as having been read.
The gentleman from the 51st asks unanimous consent that the further reading of the journal be dispensed with and that it be approved as having been read. Are there objections? There are no objections. Lady from the 49th for a calendar update.
Thank you, Mr. Speaker. On special calendar first reading, committee substitute for House Bill 3102 has been transferred to the House calendar. And on House calendar second reading, committee substitute for House Bill 2702 and committee substitute for 2792 have been transferred to the special calendar.
Introductions. Reports of standing committees.
Your Committee on Rules has had under consideration House Concurrent Resolution 12, Charles E. Jarvis Memorial Bridge, House Concurrent Resolution 25, William Edward Freese Memorial Bridge, House Concurrent Resolution 26, Victor Yoke Memorial Bridge, House Concurrent Resolution 33, Norman A. and Carrie G. Silver Memorial Bridge, House Concurrent Resolution 48, to balance the judicial workload and realign the current court systems based on their caseloads, and House Concurrent Resolution 56, create a resolution urging the FDA not to pass certain rules, reports the same back with recommendation that each be adopted.
The report will be received.
Originating in the Committee on Technology and Infrastructure is House Bill 3302, relating generally to broadband enhancement and expansion policies. It's reported with recommendation that it do pass that it be referred to the Committee on Finance.
The report to be received. The bill will be referred to the Committee on Finance.
Your Committee on Finance has had under consideration House Bill 2793, permit out-of-state residents to obtain West Virginia concealed carry permits. Reports back at committee substitute, therefore, with recommendation that the committee substitute do pass.
The report will be received.
Your Committee on Finance has had in consideration House Bill 2493, providing valuation limitations for coal property taxation and clarifying the penalties for non-filers, reported with the recommendation that it do pass.
The report will be received.
Originating in the Committee on Judiciary is House Bill 3303, relating to clarifying the process of filling vacancies on ballots. It's reported with the recommendation that it do pass.
The report will be received.
Your Committee on Judiciary has had under consideration committee substitute for Senate Bill 439, allowing use or non-use of safety belt as admissible evidence in civil actions. Reports the same back with the recommendation that it do pass.
Report to be received.
Your Committee on Judiciary has had under consideration House Bill 3261, relating to adoption attorneys. Reports the same back with the title amendment with the recommendation that it do pass, that it be reported to the Committee on Finance.
The report to be received and the bill will be referred to the Committee on Finance.
Your Committee on Judiciary has had under consideration House Bill 2747, transferring the parole board to the Office of Administrative Hearings. Reports back at committee substitute, therefore, with recommendation that the committee substitute do pass.
The report will be received.
Your Committee on Government Organization has had under consideration House Bill 2719, relating to the division of motor vehicle use of electronic means and other alternate means to provide notice, and House Bill 2721, providing electronic notice of school attendance and satisfactory progress to the Division of Motor Vehicles in lieu of requiring each student to provide a paper notice. Reports the same back with the recommendation that each do pass.
Report will be received.
Your Committee on Government Organization has had in consideration House Bill 2773, permitting DNR to issue up to 100 permits for boats greater than 10 horsepower on Upper Mud River Lake. Reports back to committee substitute, therefore, with the recommendation that the committee substitute do pass.
Report will be received.
Your Committee on Government Organization has had in consideration House Bill 3059, making contract consummation with state more efficient. Reports the same back with the recommendation that it do pass.
Report will be received.
Your Committee on Government Organization has had under consideration House Bill 3002, update road abandonment process. Reports back at committee substitute, therefore, with the recommendation that the committee substitute do pass.
The report will be received.
Your Committee on Government Organization has had under consideration House Bill 2890 to clarify the regulatory authority of the Public Service Commission of West Virginia over luxury limousine services. Reports back to committee substitute, therefore, with recommendation that the committee substitute do pass.
The report will be received.
Your Committee on Government Organization has had under consideration House Bill 2962, relating generally to dental practice. Reports back to committee substitute, therefore, with the recommendation that the committee substitute do pass.
The report will be received.
Originating in education is House Bill 3305, relating to required course of study. It's reported with recommendation that it do pass.
The report will be received.
Originating in the Committee on Education is House Bill 3306, relating to virtual instruction. It's reported with recommendation that it do pass.
The report will be received.
Your Committee on Education has had in consideration House Bill 3217, Student Rescue Act, reported with recommendation that it do pass, that it be referred to Committee on Finance.
The report will be received and the bill will be referred to the Committee on Finance.
Your Committee on Education has had in consideration House Bill 3157, the Forming Open and Robust University Minds Act. It's reported with amendment with recommendation that it do pass as amended, that it be referred to the Committee on Judiciary.
The report will be received and the bill will be referred to the Committee on Judiciary. Are there further reports of standing committees? If not, reports of select committees. Message from the executive, message from the Senate,
The clerk of the Senate announced that the Senate has rejected the House Amendments to Senate and requests the House to recede on committee substitute for House Bill 2263, update the regulation of pharmacy benefit managers.
Lady in the 49th.
Thank you, Mr. Speaker. I move that the House refuse to recede from its amendments and the Senate be requested to agree to the appointment of a committee of conference of 3 from each House of the disagreeing votes of the 2 Houses, and that the Speaker be authorized to appoint conferees on the part of the House.
The lady from the 49th moves that the House refuse to recede from its amendments on committee substitute for House Bill 2263, and that the Speaker be authorized to appoint conferees. This is a debatable question. Is there discussion on the motion? If not, those in favor of the motion, please say aye. Those opposed, please say no. The ayes have it. The chair declares that motion adopted. On that conference committee, the chair appoints the gentleman at 28th, Dougett Pack, the gentleman at the 40th, Dougett Jeffries, and the gentleman at the 19th, Dougett Griffith. Further Senate messages.
The Senate has passed without amendment House Bill 2905 relating to repealing the prohibition against the use of certain words.
The message will be received.
The Senate has concurred in a House amendment and passed committee substitute for Senate Bill 156, authorizing the Department of Homeland Security to promulgate legislative rules.
The message will be received.
The Senate has concurred in the House amendments and passed committee substitute for Senate Bill 160, authorizing the Department of Revenue to promulgate legislative rules.
The message will be received.
The Senate has concurred in the House amendments and passed committee substitute for Senate Bill 182, authorizing miscellaneous agencies and boards to promulgate legislative rules.
The message will be received.
The Senate has passed committee substitute for Senate Bill 395, expanding PEIA Finance Board membership.
The message will be received and the bill will be referred to the Committee on Finance.
The Senate has passed committee substitute for Senate Bill 398, limiting eligibility of certain employers to participate in PEIA plans.
The message will be received and the bill will be referred to the Committee on Finance.
The Senate has passed committee substitute for Senate Bill 478, permitting use of established federal marketplace programs to purchase supplies.
The message will be received and the bill will be referred to the Committee on Government Organization.
The Senate has passed committee substitute for Senate Bill 479, relating to West Virginia Veteran Service Declaration and West Virginia Service Cross.
The message will be received and the bill will be referred to the Committee on Government Organization.
The Senate has passed committee substitute for Senate Bill 586, providing West Virginia veterans discounts on fees and charges at state parks.
The message will be received and the bill will be referred to the Committee on Finance.
The Senate has passed Senate Bill 693, updating certain definitions and terms used in West Virginia Personal Income Tax Act.
The message will be received and the bill will be referred to the Committee on Finance. Are there further Senate messages? If not, resolutions.
House Concurrent Resolution 68, providing for the issuance not to exceed $22 million of refunding bonds pursuant to the Safe Roads Amendment of 1996.
Lady from the 49th.
Thank you, Mr. Speaker. I ask unanimous consent that the further reading of resolutions introduced be dispensed with and that each resolution be considered as formally introduced and referred to the appropriate committees as indicated on the delegate console system.
The lady from the 49th asks unanimous consent that the further reading of resolutions introduced be dispensed with and that each resolution be considered as having been formally introduced and referred to the appropriate committees as shown on the delegate console system. Are there objections? There are no objections. Petitions, motions, bills introduced, unfinished business, bills on third reading.
Committee substitute for Senate Bill 517, relating to sunset provisions of legislative rules.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman on the 15th to explain the bill.
Thank you, Mr. Speaker. This bill, it came to our attention in Rules Committee that there was a problem with the sunset provision clause where on a gubernatorial election year that a rule may sunset before this body had the chance to take action on it. So that the date that they sunset, rather than being 5 years from the enacting section, which is when it passed this House, it needed to be pushed back a little bit. So after the amendment yesterday, these rules would be pushed back. Any new rule, 2 different ways we fix this. One, any new rule that is promulgated that has a sunset provision will expire on August 1st. So it'll expire August 1st of the 5th year. And then any other rule that is currently enacted that has a date earlier than May 1st will also be allowed, the Secretary of State will be allowed to push that back to the August 1st of that year. So, Mr. Speaker, I'd urge passage.
question before the House is, shall the bill pass? Is there debate on the bill? If not, the question is, shall the bill pass? Those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee substitute for Senate Bill 517 relating to sunset provision of legislative rules.
Are there amendments to the title?
Delegate Foster moves to amend the title.
The question before the House is the title amendment. Those in favor of adoption of the title amendment will please say aye. Those opposed will please say no. The ayes have it. The chair declares the title amendment adopted. The title as amended by the House will be and remain the title of the bill. Lady from the 49th.
Mr. Speaker, I move the bill take effect from passage.
The lady from the 49th moves that the bill be made effective from passage. Those in favor of the motion will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. 2/3 of members having voted in the affirmative. The chair declares the bill effective from passage. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
House Bill 2028, exempting veterinarians from the requirements of controlled substance monitoring.
Are there objections to having the bill explained in lieu of having read? If not, the gentleman the 28th to explain the bill.
Thank you, Mr. Speaker. Good morning. This is a bill to exempt veterinarians from requirements of controlled substance monitoring. You may recall that we passed a bill similar to this earlier in the session. However, in that bill, there was a term that was not thoroughly defined, and this bill simply clarifies that oversight. Mr. Speaker, I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 1 nay, and 2 members absent or not voting. A majority of members having voted in the affirmative. The chair declares that bill passed. The clerk will please report the title.
House Bill 2028, exempting veterinarians from the requirements of controlled substance monitoring.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
House Bill 2029 relating to teacher preparation clinical experience programs.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman the 27th, Delegate Ellington, to explain the bill.
Thank you, Mr. Speaker. The purpose of this bill is to simply remove a potential nomenclature conflict between the statutory teacher in residence program that was enacted in 2012 and a senior year resident teacher program that was approved by the State Board more recently. The bill changes the name of the statutory teacher in residence program to clinical teacher of record in the program description in section 18A31 and permit that they are required to hold in the 18A32A. It also adds the resident teacher as a type of clinical experience in teacher preparation in addition to the current student teaching. Mr. Speaker, I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative. The chair declares the bill passed. The clerk will please report the title.
House Bill 2029 relating to teacher preparation clinical experience programs.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
Committee substitute House Bill 2427, authorizing the Department of Health and Human Resources to promulgate legislative rules.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman the 28th to explain the bill.
Thank you, Mr. Speaker. This is the DHHR rules bundle. It contains 15 rules from across the DHHR universe. Our friends in the Committee on Rulemaking Review, as well as the Committee on Government Organization, have reviewed these rules. They include provisions to update the licensure requirements for hospitals, nursing homes, behavioral health facilities, residential care facilities, child placing agencies, and dog bars. In case you're curious, a dog bar required to have a procedure in place to address dog accidents, and after further review, that does include number 1 and number 2. Mr. Speaker, I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 95 ayes, 2 nays, and 3 members absent or not voting. Majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee Substitute House Bill 2427, authorizing the Department of Health and Human Resources to promulgate legislative rules.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. Lady from the 49th.
Thank you, Mr. Speaker. Due to this is the dog bar bill, I'm going to move it effective from passage.
The question before the House is the motion that the bill become effective from passage. Those in favor of that motion will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 1 nay, and 2 members absent or not voting. 2/3 of members having voted in the affirmative, the chair declares the bill effective from passage. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
House Bill 2874, extend the current veterans' business fee waivers to active duty military members, their spouses, and immediate family members.
Gentleman to 64th, Doggett Householder.
Mr. Speaker, I ask unanimous consent to amend the bill on third reading.
The gentleman to 64th asks unanimous consent to offer an amendment to the bill on third reading. Are there objections? There are no objections. Are there amendments?
Delegate Householder moves to amend the bill. This is HFA Householder 3-24, number 1.
Are there objections to having the amendment explained in lieu of having it read? If not, the gentleman is recognized.
Thank you, Mr. Speaker. Your Committee on Finance reported this bill with a committee substitute. The committee report for the bill failed to report this committee substitute. This amendment strikes the introduced version of the bill and inserts the language of the committee substitute. The Committee on Finance language incorporates the provisions of the amendment made by the Committee on Veterans Affairs and Homeland Security, which had the current exemption from certain filing fees for veterans to include active military members and their spouses, and the spouses of veterans, and made other clarifying and technical corrections. I urge adoption.
The question before the House is the amendment just explained by the gentleman from the 64th. Is there debate on the amendment? If not, the question is, shall the amendment be adopted? Those in favor of adoption will say aye. Those opposed will say no. The ayes have. The chair declares the amendment adopted. The clerk will read the bill again a third time as amended.
House Bill 2874, extend the current veterans' business fee waivers to active duty military members, their spouses, and immediate family members.
The question before the House is, shall the bill pass? Are there objections to having the bill explained in lieu of having it read? If not, the gentleman from the 64th.
Thank you, Mr. Speaker. The bill would amend the West Virginia Code relating to certain fees for services provided by the West Virginia Secretary of State. Current law provides an exemption for veteran-owned businesses from the fee for filing documents with the Secretary of State's office. This bill would expand this exemption from fees to businesses owned by active duty member of any branch of the U.S. military or a business owned by any veterans or active duty member's spouse. I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
House Bill 2874, extend the current veterans' business fee waivers to active duty military members, their spouses, and immediate family members.
Are there amendments to the title?
Delegate Householder moves to amend the title.
The question before the House is the adoption of the title amendment. Those in favor of the title amendment will say aye. Those opposed will say no. The ayes have it. The chair declares the title amendment adopted. The title as amended by the House will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
Committee substitute for House Bill 2982 relating to the Second Chances at Life Act of 2021.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman to 32nd to explain the bill.
Thank you, Mr. Speaker. Good morning, everyone. It's a great morning to be alive. House Bill 2982 relates to creating the Second Chance at Life Act. Requires that information about the process of chemical abortions be provided to a woman prior to prescribing pharmaceuticals for or administering a chemical abortion, except in certain emergency circumstances. It updates definitions, specifies that a woman be informed of the possibility of reversal of a chemical abortion if undertaken within a critical time period, and dictates minimum standards for printed materials. Finally, it requires documentation of procedures to be required. That is a summary, Mr. Speaker. I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? The gentleman from the 27th, Delegate Ellington, is recognized.
Thank you, Mr. Speaker. I was approached by several members to give some medical background. I don't want to give my opinion on the bill or not. If you would give me some leeway, just explain some things that might help cut down some questions at the end. First, a number of people here may not, we have a lot of new members, so they may not know exactly what I do, what my background is. And I actually understood that there was one of our older members here that thought I was a foot doctor. So I need to dispel that, okay? But I do have a research background before I went into medicine. Both the speaker and I both did a lot of bench research, have doctorates in chemistry. At one time we had the moment of insanity and decided to go into other professions. But I ended up going into medicine. I've been a practicing obstetrician here in Princeton since 2002, practiced in North Carolina for 7 years before that. I am board certified in obstetrics and gynecology. I am a fellow of the American College of Obstetricians and Gynecologists. I belong to the West Virginia section of ACOG also. So I would be probably your resident expert if you consider me an expert on that. I don't consider myself maternal fetal medicine. I did have tendencies to go into repro-endocrine, other than my wife telling me I had to get a job. Said to go ahead and put food on the table instead of going into school for a longer time. But that was a specialty of mine that I wanted to go into, so I do have a little bit of training in repro-endocrine. The bill has a number of things. I think there were some misconceptions or inconsistencies that were presented, and that's what I want to clear up. So I want to give you an easy, quick explanation of hormonal stuff, the treatment, so you don't get confused on these things. As you know, hormones, there are multiple hormones in the endocrine system that regulate your body. The sex hormones that most of you are aware of would be things like androgens, which are your male hormones like testosterone. You have estrogen and progesterone. Mostly women have those because of their ovaries. Those are what make changes. Estrogen, progesterone regulates the menstrual cycles. The medications that have been used have different properties on those hormones. Progesterone was discussed yesterday in the amendment that was undertaken. Progesterone is what's called a progestational, meaning it protects the gestation or pregnancy. That's a hormone that continues. So women have had miscarriages before. Many times we put them on progesterone to support a pregnancy. That was what that medication would be used for in the case of someone trying to terminate a pregnancy that wasn't successful and they wanted to continue it. Now, there's data that support it, there's data that doesn't support it. But women have had multiple miscarriages, and some of you that may have spouses or family members that have, you know that sometimes we do try to help, and if it works, it works. If it doesn't work, it doesn't work. With any of these medications, women can have bleeding. Sometimes they could bleed a lot. Sometimes they don't bleed much. Progesterone is used in cases when women have heavy bleeding that we slow down bleeding with it. So it can be used both ways. It can cause some bleeding, but it could also decrease it. So we do that many times. Miscarriages, terminology is important. Most lay people think of miscarriage as a miscarriage terminates your pregnancy, loss of pregnancy. Under 20 weeks gestation is considered an abortion, medical term. There are different parts of that. It's called a missed abortion, which means that they had no symptoms, you just picked up no heartbeat. That's called missed. Threatened means if they're having symptoms, bleeding, cramping, but there's a fetus still alive. Incomplete means they've already passed tissue, it's not finished. That's where you would continue the process. Spontaneous complete is where someone's passed everything. That's just confirmed, that's the terminology there. Inevitable means someone that's in the process of it, it's not going to stop and they're just going to have that. So you have to look at medical terms versus the lay terms. So when we talk about losses under 20 weeks, that's considered an abortion. Okay, different than what lay people think of the term. So when we respond to that, so when you do a termination, elective termination, it would be under 20 weeks. Typically, mifepristone, which is it's hard to pronounce that sometimes, people get confused. It is an anti-progestational steroid, meaning it works against progesterone. That's how it works in trying to terminate the pregnancy. Where progesterone, like I said, supports the pregnancy, mifepristone does not. It's also named RU486, so it's easy to refer to it as RU486. Now, the second medication that is in the protocol is misoprostol. That is Cytotec as the trade name. It's an off-label use. We use Cytotec to induce labors. Lower doses, but we cause women to get into labor by using that. And the strange thing is that's standard of care, but it's also not FDA approved, which is a little problem that we may want to take care of legally here in the body sometime in the future. But we do that. Now that can cause bleeding. That's a prostaglandin. Prostaglandins cause the uterus to contract. It expels the contents. So anytime you start a process, or if someone has a miscarriage, we put them on these medications, not necessarily the RU486, but the Cytotec or other prostaglandins to cause them medically, pharmacologically, to abort the pregnancy and get rid of the tissue. That can lead to bleeding. It could lead to prolonged bleeding, hemorrhage, potential death. It can invite infection, sepsis, and all the sequelae that go with it. Prostaglandins and other medications have certain side effects to patients. Sometimes they have allergic reactions. People that have asthma are sensitive to prostaglandins. They can have asthmatic attacks. So we try to avoid those things with them. So there are a lot of medical things we discuss with the patients when we prod them on these things. But for induced abortions, not necessarily something that maybe there was a fetal demise, no heartbeat, and we wanted to deliver those people rather than doing something surgical, we usually put them on pharmacologic medications to do that. They may still have to undergo surgery, which would be like a DNC or a DNE. A DNC is dilation curettage. DNE is a dilation and evacuation. That depends on how far along the pregnancy is. Now, typically, the protocol the medical protocol is under 10 weeks, 70 days from last menstrual period. That's about 10 weeks. So if you give the RU486, that may terminate the pregnancy. Now, if it terminates, the person is going to undergo the rest of the abortion. They're going to bleed, they're going to cramp, they're either going to expel the tissue, and that's it, or they can hemorrhage, they could potentially die from it. Again, they could also get infection and have other problems, or they may need surgical therapy to fix that. So that can happen. But if they take that first pill, fetus is still alive, they can decide, well, do I not continue that if I change my mind? Well, then it's, for that person, it's 50-50. If that fetus is still alive, it'll go on like a normal pregnancy. Yes, they could have some bleeding at the time, but then that might not happen. They could also use the progesterone to support that. That would be something that would be given to them. That's what was discussed yesterday. The Cytotec, if they continue with that, there are times people can do the RU486 and the Cytotec and still not abort the pregnancy. The pregnancy's still alive, it's still viable. That person still has a decision. They decide, well, I'm not going to go any further, or then they may have to come in and have a surgical procedure. So that's it in a nutshell. Not telling you which way to go on it, but hopefully that clarifies what those medications are for. But each of those medications could cause bleeding, hemorrhage, potential death, infection, surgery. So when someone comes in and says, well, ACOG, West Virginia ACOG said, well, they could have bleeding and hemorrhage and infection. Well, yes, they can. I don't disagree with that. But that doesn't mean they can't take a chance on letting that reverse. So it's up to you what you want to do. Mr. Speaker, thank you for giving me the latitude to do that.
The gentleman from the 37th, Doug Pushkin, is recognized.
Yes, thank you, Mr. Speaker. Would the Chair of Education please yield?
Sure.
Thank you again for better explaining this legislation. Actually, I serve on the two major committees that the bill went through. we weren't able to actually hear any testimony from a doctor, from an OBGYN, on either of those committees. So I appreciate you standing up today and being actually the first OBGYN to address this legislation to any members of this body so far. We have received, as you referred to, we have received mail from a couple different groups, and that's what I wanted to ask you about. Well, first of all, you said it's not the recommendation of this hormone in between the two medications, basically. The FDA hasn't approved it for this purpose, correct?
As far as I know, they have not. I think
so it's an off-label use.
Off-label use and many things are done as an off-label use in medicine.
Okay, so we're going to put in statute what the bill would do. And once again, you just said you weren't speaking for or against the bill?
Correct, but from what I read the bill, I don't think it says you have to use that other medication. I think that would be an option that someone might discuss with them, from my interpretation of what the bill said. That you would provide information that they decide not to go into the second medication, that they would be given options of what they could do.
That they could take the hormone.
Correct.
But this is all something that you could do now, whether we pass this or not.
That is true.
A doctor who wanted to provide their patient with all the information, there's nothing preventing them from doing that right now, right?
I don't think so.
But this will put it into statute. Now, one of the in one of the letters that I believe we received from ACOG, there was a concern that you have not addressed concerning liability. Do you have any concern that if you're recommending something for an off-label use, that could leave you susceptible to a malpractice suit?
There is always that possibility. That's why I mentioned about using Cytotec to induce labor. Like I said, it's the standard of care, but it's not FDA approved. Problem with FDA approval is once you get something FDA approved, the cost of the medication or procedure gets jacked up. So they stay out of it, but it puts you in a quagmire. If you do something by standard of care, then you violate FDA if you have a problem. If you go with the FDA, then you're violating the standard of care if you're not using it the way you do it. So from our standpoint as a professional, we always face liability in everything we do.
Do you have any concern this might increase the chances of that, putting this statute out there and requiring doctors to do it?
I have no way of knowing. I would say as long as they're lawyers, that's possible. No disrespect to our lawyers.
Thanks for being the first OBGYN to address this legislation as it's made its way through our chamber here, through the process. Briefly, I'm going to address speak to the bill.
Yes, gentleman is recognized.
I do appreciate my friend explaining it. I trust his judgment on this. He didn't give an opinion on whether to vote for it or against it. I'm going to vote against it because we're putting in the statute requiring doctors to recommend an off-label use that they can already do now. And basically what the bill says is we don't trust doctors to provide women with as much information as possible, so we're going to force them and tell them how to practice. And more importantly, it also says that we don't trust women to make the right decisions for themselves. And so I think I'm going to do the unpopular thing and vote against this bill that's really not necessary because doctors can do it now.
The gentleman from the 51st, Douglas Hanson, is recognized.
Thank you, Mr. Speaker. And I also appreciate the thorough explanation from the delegate from Mercer. That was very helpful. I'm not going to talk about the medical aspects of this, but wanted to bring up a recent court case in Tennessee because West Virginia is not the first state that's potentially going down this path. Just a few months ago in August, abortion providers in Tennessee challenged a state law that was very similar to this one. It would require physicians to inform patients that were receiving medication abortions that the abortion can be reversed. And just recently, earlier this year, this court issued a preliminary injunction which held that the abortion providers are likely to succeed on their claim because the law violates the First Amendment by compelling speech that is, quote, untruthful and or misleading. This was a federal district court opinion. It was issued by a judge that was appointed by the former president. And again, it was opposed to this reversal language that's similar to the reversal language that's in the bill that we're considering today. He went on in his decision to say that the research related to reversal has numerous flaws, and requiring a physician to discuss this theory with the patient elevates the theory to a level of scientific certainty that it has not yet achieved. So I think the question before us today is whether it's appropriate and whether it's lawful to compel speech that a federal judge has just ruled to be untruthful and misleading. Thank you, Mr. Speaker.
Lady from the 4th, Dr. Zukoff's recognized.
Thank you, Mr. Speaker. Will the Chair of Education continue to yield, please?
Yes, ma'am.
Thank you. Could you explain to us how a woman who's making this choice determines whether it's a chemically induced procedure or a medical procedure?
When you counsel them, you would tell them that this is, I mean, pharmacologic, chemical, medical is the same thing. Medical could still be surgical, but
okay.
Well, you would tell them, I'm giving you medication, which would be a pharmacologic. It's just a matter of what type of terminology or how you explain it to them.
Well, how would a doctor help a woman understand those options that she has when making this decision?
Well, that's what you talk to them about. When you sit down and you say, these are your options. You can either continue a pregnancy, or if you're going to terminate a pregnancy, this is how you would do it. Whether you're going to be the person that helps them with that, or you refer them to another center, and then you tell them what the options are. Now, each person has their own way of how they do it. But, you know, as I explained to each of you, I try to explain so they understand what the process is and what their options are.
Okay.
And then as far as what would happen is if you had any problems, what you let us know.
Okay.
So, I mean,
So
each person has their own way of doing it.
So they could decide either way to go on this, is what you're telling me, correct?
Well, there's
That's
that
a
leeway,
choice?
yes.
Okay.
Yeah.
So you don't direct them one way or another. You give them their options and they make that choice.
Right. Well, one, I don't offer the RU 486. You have to be certified by the company to be able to prescribe it. So I don't do that. I mean, I use Cytotec for the other purposes. That's the other thing.
Okay. And would it be understood that if you did provide the information that's in this bill to a woman, that you would also explain to her the potential side effects?
Yes.
Even though
anytime
it's
you give
not in the bill, that's the requirement of a physician.
That's the requirement for any medications we do technically.
Okay. Thank you.
Is there further debate on the bill? The lady from 51st, Dr. Walker's recognized.
Thank you, Mr. Speaker. Permission to speak on the bill?
Yes, lady is recognized.
Good morning, colleagues. My colleague from the 32nd opened up his remarks about this bill with a statement that hit very hard for me. It is a day to celebrate, to be alive. And we should be thankful. We should be humbly honored that we got to rose and open up our eyes this morning. A positive pregnancy test. A fetus starts to grow. A decision has to be made to become a parent, or for the parents, or to terminate that pregnancy. And you start overthinking and praying, looking at your bank account. You start evaluating your mental health, your household, if you have any other children with any special needs, your own health. then I thought back to what my grandmother always said. When you become pregnant, you have 1 foot in the grave and 1 foot out. I received several emails about this bill. And several of you know I have a strong, outspoken presence on social media. And I shared something very personal with my colleagues in the Health Committee. Not for any judgment, but I'm not going to speak to you as an endorsed candidate of Planned Parenthood. I'm not going to speak to you as your colleague, but I'm going to speak to you as a person who has had an abortion. And I tweeted that. And you can pray for me, but what you shouldn't do is pass judgment on me. And the reply was, did you ever hear of birth control? Abortion is murder. Planned Parenthood is satanic. God will forgive the women who aborted. The abortionist will go to the darkest place in hell. Do not call yourself a child of God until you condemn abortion. You can be saved, Danielle. Repent. Well, I have heard of abortion, and I've heard of birth control. I didn't want to hear my rapist stripping my humanity as he forcefully, without consent, used and abused my body. He committed a crime. He killed my confidence, my choice, and my consent. In my eyes and my mind, he is the villain. I pray for him. But for many years, I held that day very close. The seconds, the minutes, the hours, and the years. My prayer was to die in that moment. I did not want to be alive. But I know my Heavenly Father heard my prayer. I had one child. It was my choice. It was a very hard one. And I'm not here to tell you how to vote one way or another. Because as I've been telling you for the past 2 years, West Virginia is my second chance home. But the added pressure that you are putting on that person who is in that office is not fair. So I leave you with this. Till you walk in my shoes, you can never sing my blues. Until you feel the pain of a broken man or woman, you can never start to understand. Have a little mercy. Show a little mercy. Give a little mercy. Listen to that song by Anthony Hamilton. Thank you, Mr. Speaker.
Lady in the 41st, Dr. Tully is recognized.
Thank you, Mr. Speaker. With the Vice Chairman of Education yield for a question. But I'm sorry, Chair of Education. I apologize. The gentleman from the 27th, I think.
I wanted to hear Higginbotham get up.
I'm sorry. No, I'm sorry. That was my error. Yes, definitely.
Yes, ma'am.
I thank you for your time that you spent talking to us today. And yesterday, I think you were present in the body when we heard a lady from the 41st mention a research study, correct?
I did.
Okay. And are you familiar with that research study?
No, I have not looked at that one in particular.
Okay, I think what it basically, I think if I summarize it correctly and what the lady's comments stated, it was there were 40 patients, they wanted to enroll 40 patients in the study, and they stopped the study prematurely because of severe hemorrhage. And I think what the study, or what the lady alleged from the 51st, was because the ladies in the hemorrhage was caused because the 2-drug series was not completed. But you stated that the first drug in the series is the RU-486.
Correct.
And by the very biological mechanism of that drug can cause hemorrhage.
Yes.
And it would not be not taking the Cytotec, which would be the second drug.
To complete that.
Right. So actually the bleeding could have happened and the ladies could have hemorrhaged just by virtue of taking the first drug.
Exactly.
Not completion of the series.
True.
Thank you.
Lady to the 51st, Dr. Fleshow is recognized.
Thank you, Mr. Speaker. Would the gentleman please rise?
Yes, ma'am. You're giving me my exercise.
Well, that's good for all of us.
It is. It's good for me, yeah.
You didn't have the benefit of looking at this study, but I think the physicians who conducted this study were surprised that after only 12 women were involved, that a quarter of them had severe side effects from not taking, from either, and 3 of them were rushed to the hospital with severe hemorrhaging, and 1 needed a transfusion. Would you agree that that's not normal for this type of procedure?
First, I did not look at that study to review it to comment on the data, so I'd hate to extrapolate on that. What I would say is anyone undergoing either a spontaneous abortion or a medically induced abortion, depending on how long it drags on, can lead to increased bleeding and the person can get anemic. And many people, when they try to go through the process on their own, end up in the emergency room in the middle of the night, and they end up having surgical procedure at that time. So I don't know what the particulars on the control of that study was, so I don't want to comment on that. But excessive bleeding requiring hospitalization is not unusual sometimes.
Okay. But if you were to assume the facts that I stated are true, that a quarter of the people that they stopped it, the study, the off-label study, because of the severe side effects, that would be unusual.
It could be, but you know, if you had a study of only 12 people, it's hard to put a lot of reliability into that.
Right. Well, they wanted to do a larger study, but when the side effects became so severe, they didn't feel that that was advisable as physicians.
Well, I don't disagree with that. Again, I did not read the study and look at how it was controlled and how it was reviewed. So I really don't want to make a comment on that. I mean, we had studies when they were doing hydrochloroquine back when they did COVID, and saying that they had reports that that was treating COVID. And once they got more numbers, you know, you could have stopped the study right then after 10 patients. It's hard to say.
Do you have any qualms that this bill mandates telling women about an off-label procedure without including a requirement that physicians also tell about potential side effects?
Let's see how I'd like to answer that. I'll give you my personal impression. One, I don't like us micromanaging how physician-patient relationships are. However, I will abide by whatever rules we're given. And I usually go beyond that with my own patients. So that's the best answer I could tell you. So.
All right. Thank you, Mr. Speaker. I'd like to address the bill. I think it's very serious that this legislation mandates speech by physicians. Like the gentleman says, it micromanages the medical profession, mandates that a procedure, an off-label procedure that has not been fully researched, that they are required to tell all patients about that, and then doesn't mention that there could be side effects. Regardless of if they're serious or not, side effects are something that's important, especially when something is off-label. So for that main reason, I'm going to be voting no, and I urge a no vote.
The lady in the 35th, Doug Young, is recognized.
Thank you, Mr. Speaker. I honestly didn't know if I was going to talk about this bill today, but a couple things just changed my mind. To me, this bill is not really about abortion. It's about informed consent between doctors. And like the doctor said, he could already do this if he wanted to. I don't know why we need to mandate it to people. And the guy, so yesterday we heard about 2 studies. We heard about the study with the 12 people that was just rehashed a little bit. Heard about the study from the gentleman from the 32nd, which was the guy who kind of started this whole movement about 10 years ago. And then I researched both of these studies last night. Turns out neither one are peer-reviewed, which means we have no actual medical data as to whether this works or it doesn't work. I don't know if it works or it doesn't work. I don't know that any of us know that it works or it doesn't work, because none of these studies are peer-reviewed. And like the doctor just said, he was just talking about hydrochloroquine. The guy who did the study, the pro-life guy, studied like 750 women who were pregnant. He observed them. There was no control group. We can't really, trust that because it's not a real study. It's an observation. And that guy, if you're wondering, is now a COVID denier. So that tracks. And I just think that, if we're going to mandate something like this, it reminds me as if we put something in code to mandate that we all try hydrochloroquine. It might work, it might not work, who knows? But I don't think that this is something that doctors should be mandating anyone to do. Thank you.
Is there further debate on the bill? Does the gentleman from 32nd wish to close debate on the bill?
Thank you, Mr. Speaker. First of all, I just want to state that no one is attempting to be judgmental here, not myself, and I don't believe anyone else in this room. That's the furthest thing that any of us want to do or should do. What this bill does, it enhances informed consent. If you change your mind, it may be possible to avoid, cease, or even stop the intended effects of a chemical abortion utilizing mifepristone. That's the other part of the informed consent, so that the female can get all of the information, or at least let's make an attempt that she get all of the information and all of the options. Really what this bill does, it speaks to the other person in the equation. In these situations, let's not forget, there are 2 people. You have the mother and you have the unborn child. So telling the mother, who can communicate verbally, if you change your mind, it may be possible to reverse this first medication. I think that is the cap on informed consent. I urge passage, Mr. Speaker.
The question before the House is, shall the bill pass? Those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 83 ayes, 15 nays, 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee Substitute for House Bill 2982, relating to the Second Chances at Life Act of 2021.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will communicate the action of the House to the Senate. Next bill on 3rd reading.
House Bill 3045, relating to firefighter disability claims.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman from the 35th to explain the bill.
Thank you very much, Mr. Speaker. In 2018, this House amended the West Virginia Code to create a rebuttable presumption for certain occupational diseases, including cancer, for volunteer firefighters who have, quote, developed leukemia, lymphoma, or multiple myeloma arising out of and in the course of employment as a firefighter, end quote, if certain criteria have been met. This was, however, to sunset after 5 years, and the bill before you removes that sunset provision. I urge passage of the bill.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 1 nay, and 2 members absent or not voting. Majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
House Bill 3045, relating to firefighter disability claims.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
House Bill 3164, relating generally to kidnapping.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman from 35th to explain the bill.
Thank you, Mr. Speaker. The bill before you clarifies our kidnapping law in West Virginia and is a result of a tragic case that happened in southern West Virginia where there was a conviction on kidnapping, and based on the jury instruction in that case, that conviction was overturned. It wasn't for error necessarily of the jury instruction, because the jury instruction was pursuant to the current West Virginia Code. And what we are doing here is cleaning that up to ensure that this never happens again. The bill modifies the current language of kidnapping to correct an error in the elements of kidnapping. And it states that any person who unlawfully takes custody of, conceals, confines, transports, or restrains another person against his or her will by means of force, threat of force, duress, fraud, deceit, etc., etc. To hold another person for ransom, reward, or concession, or 2, inflict bodily injury, 3, terrorize the victim or another person, or 4, to use another person as a shield or hostage, is guilty of a felony, and upon conviction thereof shall be punished by imprisonment, the Department of Corrections, and rehabilitation for life. The issue that arose was there was no act of transportation. So what this bill provides is that the element of transporting the victim is not necessary in order to convict on the charge of kidnapping. Mr. Speaker, that's a summarization of the bill. I urge its passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
House Bill 3164, relating generally to kidnapping.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
House Bill 3177, removing expired, outdated, inoperative, and antiquated provisions and report requirements in education.
Are there objections to having the bill explained in lieu of having read? If not, the gentleman the 27th to explain the bill. Delegate Ellington.
Thank you, Mr. Speaker. This bill repeals 14 sections of code, updates 3 sections, and updates an article dealing with the long-dormant State Board of School Finance. The repealed sections are, and I'll go through these, try to do it briefly, 1825D that required a State Board report in December of 1995, 18213B that gave the State Board flexibility in using revenue from dormitories that financed from bonds prior to 1947, 18224 that dealt with the now repealed Master Plan for the Professional Development, REISs, and the Center for Professional Development, 18229 that was passed in 1988 that provided for a competitive grant program that was superseded by innovation zones. 18235 provided for State Board rule to guide counties in adopting policies requiring student uniforms. 182E4A allowed report cards on the school's test scores and other measures, which are now posted electronically, to be sent home with students rather than mailed. 1839B required a reduction in Department of Education salaries, benefits, and contracts that were budgeted for fiscal year 14 and 15. 18412, which created an ongoing exception to a statute on county board meeting for setting the superintendent's salary, which is now antiquated due to amendment to the prevailing statute. 18518E, which required a LOCIA study in 2002. 18543 required a county board report to the State Board in 1995. 187836 required a study of the state retirement system in 1989. 189A8A, which provided funding for REISs, which were repealed in 2017. 189B11A allowed the State Board of School Finance to adjust the county's average daily attendance for use in computing state aid when there were abnormal circumstances. The current formula uses net enrollment rather than attendance as a primary factor in state aid. 1810H4 required the Board of Regents to establish a plan for a PhD program in the VOTEC in 1991. The amended sections remove cross-references to sections that have been repealed, remove the provisions that phase out an incentive for the use of biodiesel as an alternative fuel, and replace references to the State Board on School Finance with the State Superintendent. The bill also amends the entire article of 189B, the State Board of School Finance, replacing the board with the superintendent and correcting references to the State Tax Commissioner as the Chief Inspector to reflect the transfer of those duties to the State Auditor in 1999. Mr. Speaker, this will help save a few trees. I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 98 ayes, 0 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
House Bill 3177, removing expired, outdated, inoperative, and antiquated provisions and report requirements in education.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
Committee substitute for House Bill 3215, amending the requirements to become an elected prosecutor.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman of 32nd to explain the bill.
Thank you, Mr. Speaker. If I lose this bill, I'm going to have to hang up my law license. This bill creates a new law. It's a very novel concept. That if a person is running
House will be in order.
If a person is running for a county prosecuting attorney in the state of West Virginia, that person shall have a active law license in order to file and run for that office. That is the bill, Mr. Speaker. I urge passage.
The question before the House is, shall the bill pass? Is there debate on the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. All right, the clerk will close the machine and ascertain the result. On this question, there are 96 ayes, 2 nays, and 2 members absent or not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee substitute for House Bill 3215, amending the requirements to become an elected prosecutor.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Are there further bills on third reading? If not, bills on second reading.
Committee substitute for House Bill 2702 to require all public high school students to complete and submit a fee application for federal student aid prior to graduation.
Are there amendments? If not, the bill will be advanced.
Committee substitute for House Bill 2726, allowing for the lease of airspace above public roads for the safe operation of unmanned aircraft.
Are there amendments? If not, the bill will be advanced.
Committee substitute for House Bill 2792, relating to the expansion of direct access to natural gas for new customers.
Are there amendments?
Delegate Capito moves to amend the bill. This is HFA Capito 3-24, number 1.
Are there objections to having the amendment explained in lieu of having it read? If not, the gentleman of 35th to explain the amendment.
Thank you very much, Mr. Speaker. The amendment before you simply provides what we already know to be law, but clarifies that due to some apparent confusion. And the amendment states that that the Public Service Commission shall have no jurisdiction over FERC-regulated gas companies. Again, that is the law, but we are making it express here. Thank you.
The question before the House is the amendment. The gentleman of the 8th, Douglas Anderson.
Thank you, Mr. Speaker. I support the adoption of this amendment. It clarifies the bill and helps the bill. Thank you.
Is there further discussion on the amendment? If not, the question is, shall the amendment be adopted? Those in favor of the amendment will say aye. Those opposed will say no. Ayes have it. The chair declares that amendment adopted. Are there further amendments? If not, the bill will be advanced to third reading. Next bill on second reading.
Committee substitute for House Bill 2953 to clarify that counties can hire firefighters as paid staff and to modify the existing procedures to include a procedure of public hearing to commission a vote.
Are there amendments? If not, the bill will be advanced. Were there amendments?
House Bill 3107, declaring a post-traumatic stress disorder diagnosed by a licensed psychiatrist is a compensatable occupational disease for first responders.
Are there amendments?
Delegate Capito moves to amend the bill. This is HFA Capito 3-24, number 1.
Are there objections to having this amendment explained in lieu of having it read? If not, the gentleman in the 35th to explain the amendment.
Thank you very much, Mr. Speaker. We're striking subsection 5 here. When we discussed this bill in committee, there was perhaps some consternation surrounding whether we were creating, if this section was misconstrued, that we were creating a new cause of action. So the section is unnecessary and, again, could be construed to create a cause of action against those entities who elect not to involve themselves in this optional coverage that we've created under the bill. So I urge adoption.
The question is on the adoption of the amendment. Is there debate on the amendment? If not, those in favor of adoption of the amendment will please say aye. Those opposed will please say no. The ayes have it. The chair declares that amendment adopted. Are there further amendments? If not, the bill will be advanced to third reading. Next bill on second reading.
Committee substitute for House Bill 3137 to accelerate the conversion of the transfer tax on the privilege of transferring real property from a state excise tax to a county excise tax.
Are there amendments? If not, the bill will be advanced.
House Bill 3191 requiring employers to send certain notifications when retirants are hired as temporary part-time employees.
Are there amendments? If not, the bill will be advanced.
Committee substitute for House Bill 3231, public utilities not required to pay interest on security deposits.
Are there amendments? If not, the bill will be advanced.
Committee substitute for House Bill 3293.
Are there amendments?
Relating to single-sex participation in interscholastic athletic events.
Are there amendments? If not, the bill will be advanced.
House Bill 3294 relating to unemployment insurance.
Are there amendments?
Delegate Capito moves to amend the bill. This is HFA Capito 3-23, number 1.
Are there objections to having this amendment explained in lieu of having it read? If not, the gentleman in the 35th to explain the amendment.
Thank you, Mr. Speaker. The first part of the amendment strikes out a definition that's not used in the section, so we're striking that. The other piece of the amendment creates a vendor-neutral situation where we were checking against employment roles. We had that was narrowed down to a single vendor, so we're opening that up to make it, again, vendor-neutral. Urge adoption.
The question before the House is the amendment just explained by the gentleman from the 35th. Is there debate on the amendment? If not, those in favor of adoption of the amendment will please say aye. Those opposed will please say no. The ayes have it. The chair declares that amendment adopted. Are there further amendments? If not, the bill will be advanced to third reading. Next bill on second reading. Or are there bills on second reading? If not, bills on first reading.
Senate Bill 67 relating to authority of Emergency Medical Services Advisory Council.
Bill will be advanced.
Committee substitute for Senate Bill 356 allowing for written part of driver's exam in the high school driver's education course.
The bill will be advanced.
Senate Bill 390 reorganizing healthcare authority under DHHR and clarifying responsibilities for all payer claims database.
The bill will be advanced.
Committee substitute for Senate Bill 431 relating to school attendance notification requirements to DMV.
The bill will be advanced.
Committee substitute for Senate Bill 435 requiring county superintendents to authorize certain school principals or administrators at non-public schools to issue work permits for enrolled students.
The bill will be advanced.
Committee substitute for House Bill 2145 relating to student aid class titles.
The bill will be advanced.
Committee substitute for House Bill 2146 2573, relating generally to the transparency and accountability of state grants to reduce waste, fraud, and abuse.
The bill will be advanced.
Committee substitute for House Bill 2694, create the Second Amendment Preservation Act.
The bill will be advanced.
Committee substitute for House Bill 2842, preventing cities from banning utility companies in city limits.
The bill will be advanced.
Committee substitute for House Bill 2981, providing veterans with suicide prevention assistance.
The bill will be advanced.
Committee substitute for House Bill 3254, authorizing members of development authorities to accept federally authorized reimbursement for services which the members rendered on a voluntary basis.
The bill will be advanced.
Committee substitute for House Bill 3266, providing for termination of extracurricular contact upon retirement.
The bill will be advanced.
House Bill 3299, authorizing higher education rules.
The bill will be advanced.
House Bill 3300, relating to reducing personal income tax rates generally.
The bill will be advanced.
House Bill 3301, relating generally to property tax increment financing districts.
The bill will be advanced. Are there further bills on first reading? If not, leaves of absence. Lady from the 49th.
Thank you, Mr. Speaker. For our colleagues, Delegates Steele and Scaff.
Are there objections to leaves of absence being granted? If not, leaves of absence shall be granted. Introductions. Miscellaneous business. The gentleman from the 3rd, Douglas Fluharty, is recognized.
Thank you, Mr. Speaker. I would ask that the remarks by the gentlelady from the 51st, Delegate Walker, on House Bill 2982 be printed in the appendix of the journal.
Are there objections? There are no objections. The gentleman from the 30th, Douglas Bates.
Yes, thank you, Mr. Speaker. Would the Chair of Finance, the gentleman, yield for just a brief question?
Yes.
Thank you, sir. Just inquiry with regard to the budget process. We're going to be voting on a bill, I think, Friday, that deals with personal income tax. And reviewing the fiscal note, it appears that does have an impact on this coming year's budget. My understanding is that it's the Senate's turn to lead with the budget. Is that correct?
No, it's the House's turn.
I'm sorry, thank you.
Yep.
So when would you anticipate that we'll have a chance to look at the budget calculations prior to voting on that bill?
We're going to probably have the budget presentation on Monday, March 29th in committee.
Okay, so we'll have the bill before us that deals with personal income tax prior to
That's exactly right.
Looking at the budget bill.
Correct.
But my understanding is that you would have incorporated the passage of that bill as well as the passage of the public funding of private education, the $30 million from that bill, into your budget presentation.
That bill does, the Hope Scholarship is on the 2023 budget.
I'm sorry, I was looking at the fiscal note in the system. It appears that it impacts 2022.
It does not.
Okay, I'll review that again, but thank you, sir.
Yep.
Thank you, Mr. Speaker.
Lady in the 49th, yes, the gentleman from 3rd, Douglas Fluharty.
Quick point of inquiry, Mr. Speaker.
Yes.
I had this wonderful piece of literature on my desk, Alec book. Seems like a nice guy. Just wondering, when things are placed on our desk, I believe there's supposed to be an initial there so we know exactly where it came from. Just figuring it out so I can thank the person for putting it on my desk.
That is the chair's understanding that items distributed to members are to be sponsored by a member.
Okay. But there's no sponsor, just want to know. So if anybody wants to come over and, converse on Alec books, I'm happy to do that with you. Thank you, Mr. Speaker.
The gentleman's point is well taken. Items distributed broadly to the members at official desks are to be sponsored by an actual member of the body. Is there other miscellaneous business? Yes, lady from the 51st, Douglas Walker is recognized.
Thank you, Mr. Speaker. If I can ask each of you to just stand with me in a moment of silence as I lost my West Virginia father this morning. My best friend lost her father, who has been fighting for a week in ICU with a brain bleed at the brainstem.
If members and guests in the galleries would please rise, the House will observe a moment of silence. Members and guests may be seated.
Thank you, Mr. Speaker.
Lady in the 49th.
Thank you, Mr. Speaker. I move subject to announcements. The House adjourn until 11 a.m. Thursday, March 25th.
Are there announcements? Lady in the 49th.
Your Committee on Rules will meet at 10:45 Thursday in House Education.
Chair will announce at this time that the House will be in order at 5 p.m. this evening to receive remarks by members. Gentleman of the 10th, Doug Chris.
Thank you, Mr. Speaker. Your Committee on Finance will meet today at 4 p.m. in the House Finance Committee room. The agenda is posted. Your Committee on Finance will also be meeting tomorrow morning at 9 a.m. in the House Committee room. The agenda will be posted. Thank you, Mr. Speaker.
Gentleman of the 64th, Doug Householder.
Thank you, Mr. Speaker. Just a reminder, the Committee on Finance will be holding a public hearing on House Bill 3300, the personal income tax reduction. It's on a Teams platform for tomorrow, Thursday, March 25th, from 3 to 4 p.m. And anyone who wishes to speak during the public hearing must call today between the hours of 1 p.m. to 2 p.m. And the number is 304-340-3230. Thank you, Mr. Speaker.
The gentleman of 32nd, Doug Fast.
Thank you, Mr. Speaker. Your Committee on Judiciary will meet tomorrow morning at 8 a.m. in the committee Judiciary room, and the agenda will be posted. We will be taking up House Bill 2017, which is the criminal rewrite bill, and the rumor has it that donuts will be provided.
The gentleman of 13th, Doug Higginbotham.
Thank you, Mr. Speaker. Your Committee on Education will meet today at 2 p.m. in the House Education Committee room. The agenda is posted. Also, Mr. Speaker, Education will meet again tomorrow at 1 p.m. in the Education Committee room, and that agenda will also be posted at a later time.
The gentleman of 15th, Doug Foster.
Thank you, Mr. Speaker. Your Committee on Government Organization will meet tomorrow, March 25th at 2 p.m. in the Government Organization Committee room. The agenda will be posted.
The gentleman of 31st, Doug Tony.
Thank you, Mr. Speaker. A reminder, your Committee on Veterans Affairs and Homeland Security will meet today at 3 p.m. in the Government Organization Room. The agenda has been posted.
The gentleman of 7th, Doug Barnhart.
Thank you, Mr. Speaker. Your Committee on Workforce Development will meet today at 1 p.m. in the House chamber. And the agenda has been posted. And additionally, Republican members will caucus at 12:50 in 203E in the East Wing, Chairman Zeteslo's office. Thank you.
Lady from the 41st, Doug Tully.
Thank you, Mr. Speaker. I actually have two announcements. The PEIA subcommittee of the Committee of Health and Human Resources will meet today at 4 p.m. with a room change. We are moving to the House Judiciary Committee room due to the audio difficulties in the East Wing. And I'd also like to congratulate my friend and the gentleman from the 32nd and my good friend, Delegate Fast, for being the recipient of the 2021 West Virginia Nurses Association Friend of Nursing Award. We know that the delegate was raised right and married well because both his mother and his wife are nurses. Thank you.
Further announcements? If not, the question is on the motion that the House stand adjourned at 11 a.m. tomorrow. Those in favor will please say aye. Those opposed, please say no. The ayes have it. The motion is adopted. The House is adjourned at 11 a.m. tomorrow.